Can you wait a minute? We are not yet live in Facebook.
We will be going Facebook Live. So I'm. You should do prompt me.
Sorry, your call. Yeah, okay.
So we are live now. Thank you. So this is a very knowledgeable gathering where we
recording in progress.
So I do not need to elaborate on the context very much. The only thing I would like to say that the demand for data, credible, real-time, usable data has increased tremendously during the last 2 years. If you want to look for any positive fallout from this pandemic, then it is the enhanced awareness about the need for data and their more practical use in decision-making. What many of us had been trying to impress upon the policymakers for decades was done in the last 2 years very, I think, efficiently, and the message was driven home to those who are the real data managers. Thankfully, during this period, we have seen very many new data initiatives emerging in the public sector, and we also saw a number of partnerships emerging between the public and the private sector. The whole purpose of our exercise, which the name of the paper, if many of you have seen that, we called, is titled Data for Policymaking in the Pandemic Era, Bangladesh Experience. The whole point was that we needed to document this, what actually had been happening. And so it was a mapping exercise. And whilst doing the mapping, we did really relate to the other global experiences. And at the same time, we tried to look into what are the future prospects in terms of having a sustainable institutional mechanism for use of this data and their interoperability, ensuring their quality, and how to really engage the policymakers in using this particular data in the future. We have seen this data being used both for procurement of vaccination, in terms of vaccination, in rolling out the vaccination plan, and also we have seen how the stimulus packages were also supported by these data initiatives. So Bangladesh in many ways has a great experience in this regard. We have just been in the last month or so in Bern at the World Data Forum, where we shared these experiences and was highly appreciated. In particularly the African countries were keen to know more about our experience and our challenges. So this event, which we are doing today, is essentially a final validation exercise of what we have found in our exercise or what we have written, and how does it resonate with the knowledgeable people, particularly with the policymakers, particularly the custodian of the data, the BBS, or for that matter, the information, the information ministry. No, sorry, it's not the information ministry. SID, the issue on that, the statistics and information division. So that is the whole purpose. We were a joint team. We were lucky to receive support from the Swiss Embassy in Dhaka. They had been quite forward-looking in anticipating this issue, and we had a convergence of mind. And I do thank the embassy, particularly the ambassador here, Natalie Scher. She and her colleague Thomas Blumengarten, so who had been with us on these issues and giving us the right questions. And we had a number of expert group meeting where many of you had been present, where we did the brainstorming, and finally the work was actually done by a group of my colleagues. Besides me, there was Tawfiqul Islam Khan, there was Muntasir Kamal, there was Najiba Altaf, and Marfia Alam. Young colleagues, a good mixture of team and expertise. And on behalf of our team, Muntasir Kamal is going to make the presentation today. So with the permission of the chief guest, special guest, all eminent people, and the ambassador, let me invite Muntasir Kamal on behalf of the team to make the presentation. Muntasir.
Thank you, sir.
Before you start, let me recognize the presence of our founder chairman, Professor Reman Soban, in this session. Thank you, sir, for joining. Good morning.
Good morning.
Please.
Thank you, sir, and thank you, distinguished guest and excellency, for being here today. So I'll be making the presentation in a combination of Bangla and English for better understanding. So hope it will be okay for you.
Colleagues, we do have a number of media present in our discussion today. Please, Muntasir. Thank you for the media colleagues for joining.
আমরা যে স্টাডিটার আলোকে আসলে আজকের উপস্থাপনাটি করছি সেটিতে মূলত
Muntasir, এক মিনিট. Ambassador, Excellency, you are okay that we will be using interspersing with Bangla and English. You have the PowerPoint with you.
Yes.
So
Perfect.
we won't be saying anything much beyond what is there in the PowerPoint. Okay. Thank you for permission. Thank you. Muntasir, please proceed.
Thank you, sir, and thank you, Excellency, for your permission. So যে তিনটি উদ্দেশ্য মূলত সামনে রেখে আমরা স্টাডিটা করেছি সেটা হচ্ছে যে এই কোভিড এর প্রেক্ষাপটে বাংলাদেশে তথ্য এবং উপাত্ত সংগ্রহ বা তৈরির ক্ষেত্রে যে সকল উদ্যোগ নেওয়া হয়েছে সেক্ষেত্রে যে সকল প্রসেস টুল বা পার্টনারশিপ ব্যবহৃত হয়েছে সেগুলোকে রিভিউ এবং ডকুমেন্ট করা, এবং দ্বিতীয় আমাদের যে মূল উদ্দেশ্যটা ছিল সেটা হচ্ছে পলিসি রেসপন্স নেওয়ার ক্ষেত্রে এই সকল ডেটা ইনিশিয়েটিভ কিভাবে ইউটিলাইজড হয়েছে এবং তথ্য বা উপাত্তের অপ্রতুলতা কোনোভাবে এই সকল পলিসি রেসপন্স নেওয়ার ক্ষেত্রে বাধা সৃষ্টি করেছে কিনা সেটা দেখা, এবং তৃতীয়ত আমরা বিভিন্ন আমাদের দেশীয় এবং আন্তর্জাতিক বিভিন্ন বেস্ট প্র্যাকটিস আইডেন্টিফাই করার মাধ্যমে এরকম কিছু উদ্যোগের কথা তুলে আনতে চেয়েছি যেগুলো আমরা ভবিষ্যতে বাংলাদেশে রেপ্লিকেশন বা অ্যাডাপ্টেশন করতে পারি। এবং এই স্টাডিতে আমরা মূলত ফোকাস করেছি এই সকল হেলথ রিলেটেড ডেটা ইনিশিয়েটিভ যেগুলো বাংলাদেশে কিনা কোভিড এর পরিপ্রেক্ষিতে নেওয়া হয়েছে, এবং এর পাশাপাশি আমরা একই সাথে কিভাবে পাবলিক পলিসি ইন্টারভেনশনের ক্ষেত্রে ডেটা ইনিশিয়েটিভস ব্যবহৃত হয়েছে এবং কিভাবে আমাদের এই মেইন স্ট্রিম ইকোনমিক ডেটার যে ফ্লো সেটা এই করোনাকালীন সময় কিভাবে ব্যাহত হয়েছে সেটা আমরা দেখার চেষ্টা করেছি। তো আমাদের স্টাডির যে এই মূল তিনটি উদ্দেশ্য বা অবজেক্টিভ সেটিকে আসলে আমরা 6টি হাইপোথেসিসের আন্ডারে দেখার চেষ্টা করেছি, কিন্তু এই 6টা হাইপোথেসিসের বিস্তারিত বিবরণে এই মুহূর্তে আমি যাব না, এটা পরবর্তীতে আমরা যখন আমাদের স্টাডির মূল ফাইন্ডিংস গুলি আলোচনা করব সেটার তখন এগুলো বিস্তারিতভাবে আলোচিত হবে। তো প্রথমে আমরা যদি আসলে একটু গ্লোবাল বা বহির্বিশ্বের অভিজ্ঞতার দিকে তাকাই তাহলে এটাকে আমরা মূলত দুটি ভাগে দেখতে চেয়েছি। আমরা কিছু আন্তর্জাতিক সংস্থার কি ধরনের কাজ করেছে করোনাকালীন সময় সেটি দেখেছি এবং একইভাবে বিভিন্ন দেশ কিভাবে করেছে সেটি দেখতে চেয়েছি। আন্তর্জাতিক সংস্থাসমূহের মধ্যে আমরা মূলত 5টি দিকে আলোকপাত করেছি: ইউনাইটেড নেশনস ওয়ার্ল্ড ডেটা ফোরাম, ইউএনস্ট্যাট, ইউরোস্ট্যাট, প্যারিস 21 এবং গ্লোবাল পার্টনারশিপ ফর সাস্টেনেবল ডেভেলপমেন্ট ডেটা। এবং এই সকল বহুজাতিক বা আন্তর্জাতিক সংস্থাগুলোর কাজের মধ্যে যদি আমরা করোনাকালীন সময়ে তাকাই তাহলে দেখি যে তারা মূলত দুটি ধাপে আসলে কাজগুলি করেছে। এর মধ্যে একটি অবশ্যই যেটা ছিল সেটা হচ্ছে বিভিন্ন রকমের অনলাইনের মাধ্যমে তাদের কাজগুলোকে তুলে ধরা। তো এর মধ্যে একটা অন্যতম গুরুত্বপূর্ণ জিনিস যেটি ছিল সেটা হচ্ছে তারা বিভিন্ন যারা ন্যাশনাল স্ট্যাটিস্টিক্স অফিস আছেন তাদের অবস্থাগুলো যাচাই করার জন্য বিভিন্ন রকম সার্ভে করেছেন। একই সাথে বিভিন্ন রকম ডেটা ড্যাশবোর্ড কিংবা অনলাইন প্ল্যাটফর্মের মাধ্যমে তারা ডেটা ডিসেমিনেট করেছেন। তারা এনএসও গুলোর অ্যাক্টিভিটি কন্টিনিউটি যাতে বজায় থাকে করোনাকালীন সময় সেজন্য বিভিন্ন রকমের টুলস ডেভেলপ করেছে, এবং একইভাবে তারা ক্রস লার্নিং বা পিয়ার লার্নিং ফ্যাসিলিটেট করার জন্য বিভিন্ন রকমের ভার্চুয়াল সেশন বা ফোরাম অ্যাটেন্ড করেছে, যার একটা উদাহরণ ইনফ্যাক্ট একটু আগে স্যার বললেন WDF এর কথা, যেটা এই বছরও হলো। এর পাশাপাশি তারা বিভিন্ন রকমের যে পার্টনারশিপ আছে সেগুলো তারা তৈরি করেছে, এবং এখানে আমরা দেখেছি যে তারা এর সাথে যেরকম এক্সিস্টিং পার্টনারশিপ গুলোর ব্যবহার করেছে ঠিক একইভাবে তারা নতুন পার্টনারশিপও গড়ে তুলেছেন যাতে করে করোনা কালীন সময়ে ডেটা সংক্রান্ত যেসব গ্যাপ বা চ্যালেঞ্জেস আছে সেগুলো পূরণ করা যায়। এর পাশাপাশি আমরা 5টি দেশকে আসলে তাদের অভিজ্ঞতা দেখার জন্য মূলত নির্বাচিত করেছিলাম, এবং এই নির্বাচনের ভিত্তিটা মূলত তাদের আসলে আয়ের লেভেল ছিল। 5টি কান্ট্রির নাম হচ্ছে আসলে ঘানা, ভিয়েতনাম, এস্তোনিয়া, সাউথ কোরিয়া এবং সুইজারল্যান্ড। এবং অবশ্যই বাংলাদেশের মতোই এক্ষেত্রেও দেখা গেছে যে করোনাকালীন সময় তাদের এই সকল ডেটা ইনিশিয়েটিভস এর মূল ফোকাসটাই আসলে ছিল হেলথের উপর। তবে হেলথের ভেতরেও আসলে তাদের একটা অধিকতর আসলে কনসেন্ট্রেশন ছিল কন্টাক্ট ট্রেসিং এর উপরে, এবং এই কন্টাক্ট ট্রেসিং নিয়ে কিন্তু আসলে বিতর্ক নিতান্ত কম হয়নি। বিশেষ করে ভিয়েতনাম, এস্তোনিয়া, সুইজারল্যান্ড এই সকল ক্ষেত্রে ডেটা প্রাইভেসি সংক্রান্ত বিষয়ে বিভিন্ন সময় কনসার্ন তুলে এসেছে। সাউথ কোরিয়ার ক্ষেত্রে যেটা কিনা দেখা গেছে তারা বিভিন্ন রিলেভেন্ট গভর্নমেন্ট এজেন্সি এবং প্রাইভেট এজেন্সির মাধ্যমে ক্রেডিট কার্ড ডেটা, লোকেশন ডেটা এবং অন্যান্য মুভমেন্ট ট্র্যাকিং করেছেন, যেটা কিনা ব্যক্তিগত আসলে তথ্যের উপরে আরো কিছুটা বেশি ইনভেসিভ হিসেবেও ধরা যায়। ঘানার এক্সপিরিয়েন্স এক্ষেত্রে কিছুটা ডিফারেন্ট ছিল আসলে, যে তারা অল্টারনেটিভ সোর্স বলতে তারা আসলে মূলত টেলিকম অপারেটরসদের উপরেই আসলে নির্ভর করেছেন। তারা বিভিন্ন টেলকো ডাটার উপরে নির্ভর করে একই সাথে যেরকম কন্ট্যাক্ট ট্রেসিং বা এই ধরনের উদ্যোগ নিয়েছেন, এবং পাশাপাশি তারা তাদের নিজের দেশের লোকাল বিজনেস এমপ্লয়মেন্ট বা হাউস হোল্ডের কি অবস্থা সেটিও তারা টেলকো ডাটার মাধ্যমে যাচাই করার চেষ্টা করেছেন। তো আমরা যদি ওভারআর্চিং ট্রেন্ডটা দেখি, তাহলে মেজরিটি আসলে আমাদের দেখা গেছে যে এখানে ডিজিটাল সলিউশনের দিকে গেছে। কেবলমাত্র ঘানার ক্ষেত্রে দেখা গেছে যে তারা কিছুটা টেলিফোন বেসড মেথডের দিকে ঝুঁকেছে। এবার বহির্বিশ্বের পাশাপাশি বা অন্যান্য কান্ট্রির পাশাপাশি যদি বাংলাদেশের হেলথ রিলেটেড ইনিশিয়েটিভস গুলির দিকে আমরা তাকাই, তাহলে আমরা চেষ্টা করেছি আসলে হেলথ কেয়ার ফাংশন যে 4টি মূল ধাপ আছে বা পর্যায়ে আছে সেগুলোর আলোকে দেখা, এবং এর পাশাপাশি আমরা এই 4টি ধাপ বা 4টি প্রকারের আওতায় যে বিভিন্ন রকমের টাইপ আছে তার বেসিসে আমরা আমাদের এক্সিস্টিং বাংলাদেশের হেলথ রিলেটেড ইনিশিয়েটিভস গুলোকে দেখার চেষ্টা করেছি। তো এই দুই ক্যাটাগরিতে যদি আমরা এক্সিস্টিং বাংলাদেশের ডেটা ইনিশিয়েটিভস গুলোকে সাজাই, তাহলে মূলত আসলে একটা এই ধরনের মেট্রিক্স আমরা মূলত দেখতে পাই। তবে এর বিস্তারিত বিবরণে আমি যাব না, তবে এখানে এটা বলে রাখা ভালো যে এই সকল ইনিশিয়েটিভস প্রতিনিয়ত চেঞ্জ হচ্ছে এবং নতুন নতুন ইনিশিয়েটিভস যুক্ত বা বিযুক্ত হচ্ছে। সুতরাং আমাদের এই ইনিশিয়েটিভস গুলো দেখার ক্ষেত্রে একটা কাট অফ পিরিয়ড ছিল। আমরা 30শে জুন 2021 পর্যন্ত যে সকল ইনিশিয়েটিভস এসেছে সেগুলো মূলত দেখেছি। তো এই ইনিশিয়েটিভস গুলির দিকে যদি আমরা তাকাই, তাহলে আসলে কিছু অবজারভেশনস আসলে আমাদের কাছে মূলত খুব স্পষ্ট হয়ে ওঠে। প্রথমত আমরা দেখতে পাই যে এত রকমের যে ইনিশিয়েটিভস হয়েছে, এটা আনইনিশিয়েটেডদের জন্য হয়তো কিছুটা ওভারওয়েলমিং হতে পারে, এবং এক্ষেত্রে আমাদের কাছে মনে হয়েছে যদি একটা সেন্ট্রাল ডেটা রিপোজিটরি থাকতো যেখানে কিনা সকল ধরনের তথ্য উপাত্ত এক জায়গায় থাকতো, তাহলে এটা আসলে সবার জন্য বেশ উপকারী হতো। দ্বিতীয়ত আমাদের কাছে মনে হয়েছে যে মেজরিটি অফ দ্য যে আমরা ইনিশিয়েটিভ দেখেছি এগুলো হেলথ কেয়ারের মধ্যে মূলত প্রিভেন্টিভ বা কিউরেটিভ অ্যাসপেক্টের উপরই আসলে বেশি ফোকাস করেছে, কিন্তু রিহ্যাবিলিটেটিভ অ্যাসপেক্টের উপরে সেরকম কোনো ফোকাস আমরা দেখতে পাইনি। তৃতীয়ত আমরা দেখেছি যে এই সকল ডেটা ইনিশিয়েটিভস মূলত ডিজিএইচএস কিংবা এর বিভিন্ন অঙ্গ সংস্থার যে তথ্য উপাত্ত প্রদান করে সেগুলোর উপরে নির্ভর করে আসলে গড়ে উঠেছে। চতুর্থত আমরা দেখেছি যে অনেক সময় বিভিন্ন ইনিশিয়েটিভসে একই সোর্সের একই ডেটা বিভিন্ন টাইমে বা বিভিন্ন ফ্রিকোয়েন্সিতে রিপোর্টেড হয়, যেটা কিনা অনেক সময় আসলে কিছুটা কনফিউশনের তৈরি করে। পঞ্চমত আমরা দেখেছি যে রেগুলারলি এবং আপ টু ডেট ডেটা দেওয়ার ক্ষেত্রে, বিশেষ করে স্বাস্থ্য খাতে আমরা করোনা পূর্ববর্তী সময়ের তুলনায় বর্তমানে আসলে একটা বেশ উল্লেখযোগ্য অগ্রগতি দেখতে পেয়েছি, যেটা খুবই প্রশংসনীয়। এবং এই অগ্রগতির ক্ষেত্রে অনেকটাই আসলে নির্ভর করেছে অনলাইন অ্যাভেলেবিলিটির উপর, যেটা অবশ্যই করোনা পরিস্থিতিতে খুবই এনকারেজিং। কিন্তু যেহেতু এটা অনলাইন নির্ভর, সেক্ষেত্রে আসলে কিছুটা ডিজিটাল ডিভাইডের একটা কনসার্ন এক্ষেত্রে রয়েই যায়। এবং ষষ্ঠত আমরা মূলত দেখতে পেরেছি যে বর্তমানে এই করোনাকালীন সময়ে ডেটা ডিসেমিনেশনের ক্ষেত্রে যে সকল উদ্যোগ নেওয়া হয়েছে, সেক্ষেত্রে আসলে মূলত একটা বহুমুখী অ্যাপ্রোচ নেওয়া হয়েছে। অনলাইনের মাধ্যমে হয়েছে, বিভিন্ন রকমের বুলেটিন হয়েছে, টেলিভিশনে এসছে ইত্যাদি। এর বাইরে পাশাপাশি আমরা কিভাবে পলিসি রেসপন্স নেওয়ার ক্ষেত্রে ডেটা ইনিশিয়েটিভস ব্যবহার করা হয়েছে, সেটা দুটো আমরা কেস স্টাডির মাধ্যমে দেখতে চেয়েছি। এর মধ্যে প্রথমটি হচ্ছে আমাদের 2500 টাকা ক্যাশ সাপোর্ট প্রোগ্রাম, যেটা কিনা প্রধানমন্ত্রীর ঈদ উপহার প্রোগ্রাম হিসেবেও আমরা শুরুতে জেনেছি, এবং একটা তো অবশ্যই আমাদের ভ্যাকসিনেশন কর্মসূচি, যেটা এখনো অব্যাহত রয়েছে। 2500 টাকার কর্মসূচির দিকে যদি আমরা তাকাই, তাহলে আমরা দেখতে পারি যে প্রাথমিক সুবিধাভোগীর তালিকা প্রস্তুত, সেই প্রস্তুতকৃত তালিকার যাচাই বাছাই, সেখান থেকে শর্ট লিস্ট এবং সেটার এরর কারেকশন, এবং শেষ পর্যায়ে যে কিনা মোবাইল ফিনান্সিয়াল সার্ভিসের মাধ্যমে সুবিধাভোগীর কাছে টাকা পৌঁছানো, তিনটি ক্ষেত্রেই আসলে তথ্য এবং উপাত্তের ব্যবহার হয়েছে। এক্ষেত্রে আমাদের বিডিএস, এটুআই, আমাদের মিনিস্ট্রি অফ ফাইন্যান্স, মিনিস্ট্রি অফ ডিজাস্টার ম্যানেজমেন্ট অ্যান্ড রিলিফ, আমাদের এনটিএমসি এবং আমাদের বিটিআরসি, এরকম বিভিন্ন সংস্থা আসলে বিভিন্ন ধাপে যুক্ত ছিল। তবে এই 2500 টাকার প্রোগ্রামের ক্ষেত্রে যদি আমরা তাকাই, তাহলে বেশ কিছু অবজারভেশন আসলে আমাদের কাছে তুলে আসে। যেটা কিনা আমি শুরুতেই বলেছি যে তথ্যপত্রের ব্যবহার তালিকা প্রস্তুতি যাচাই বাছাই ব্যবহৃত হয়েছে, কিন্তু এক্ষেত্রেও কিছু সমস্যা ছিল। অনেক ক্ষেত্রে দেখা গেছে কিনা যে মোবাইল নাম্বারের যে রেজিস্টার্ড সেটা এনআইডির সাথে মিলছে না, কিংবা দেখা গেছে যে রেজিস্টার্ড কোনো মোবাইল নাম্বার এনআইডির এগেইনস্টে নেই। অনেক ক্ষেত্রে দেখা গেছে যে নাম্বার রং ফরম্যাটে লেখা ছিল, কিংবা অনেক সময় ডিটেল অকুপেশন রিলেটেড ইনফরমেশন ছিল না। এবং একই সাথে যারা কিনা মাঠ পর্যায়ে আমাদের লোকাল গভর্নমেন্ট ফাংশনারি কাজ করেছে, তাদের তরফ থেকে এরকম একটা অভিযোগ অনেক সময় আমরা শুনতে পেয়েছি যে প্রাথমিক তালিকা প্রস্তুতির কাজটিতে তারা পর্যাপ্ত সময় পাননি। এবং যারা কিনা এই প্রোগ্রাম কর্মসূচিটি বাস্তবায়নে মূলত কাজ করে গেছে, তাদের ক্ষেত্রে এই কর্মসূচিটি কিভাবে বাস্তবায়িত হবে, কারা পাবে, কিভাবে দেয়া হবে, সেক্ষেত্রে তাদের কিছুটা ধারণার অভাব আমরা লক্ষ্য করেছি। আমরা যদি এরপরে টিকাদান কর্মসূচির দিকে তাকাই, তাহলে এটাকে আসলে আমরা মূলত দুটি ভাগে ভাগ করে দেখতে চেয়েছি। একটি হচ্ছে টিকার সামগ্রিক সাপ্লাই চেইন ম্যানেজমেন্ট, এবং দ্বিতীয়টি হচ্ছে অ্যাকচুয়ালি টিকা প্রদান করার কর্মসূচি। সাপ্লাই চেইন ম্যানেজমেন্টের ক্ষেত্রে যদি আমরা দেখি, তাহলে আমাদের হাতে সামনে চলে আসে যে মূলত সামগ্রিক ভ্যাকসিনের প্রাপ্যতা, আমাদের টিকাদানের সক্ষমতা, আমরা প্রতিদিন কিরকম পরিমাণে টিকা দিতে চাই এবং কাদেরকে প্রায়োরিটি বেসিসে দিতে চাই, মূলত সেগুলোর উপরে নির্ভর করেই হচ্ছে এই সাপ্লাই চেইন ম্যানেজমেন্টের কাজটা হয়েছে। তবে এক্ষেত্রে ইনফেকশন রেট, যেটাকে আমরা সচরাচর বলে থাকি, যেটাকে কিনা আসলে টেস্ট পজিটিভিটি রেট বলা উচিত, সেই জিনিসটা কিছু কিছু ক্ষেত্রে ব্যবহৃত হয়েছে, তবে এটা এত ব্যাপকভাবে ব্যবহৃত হয়নি। এবং এই সামগ্রিক সাপ্লাই চেইন ম্যানেজমেন্টের ক্ষেত্রে আমরা দেখতে পেরেছি যে সুরক্ষা পোর্টালের ডেটার পাশাপাশি বিভিন্ন রকমের অ্যাডমিনিস্ট্রেটিভ ডেটা, যেগুলো লজিস্টিক সংক্রান্ত ইনফরমেশন বা ইনফেকশন রেট দেয়, সেই জিনিসগুলি আসলে ব্যবহৃত হয়েছে। এবং অবশ্যই এখানে ম্যাক্সিমাম কাভারেজ এনশিওর করাটা এই প্রোগ্রামের একটা টিকাদান কর্মসূচির একটা মুখ্য উদ্দেশ্য ছিল, এবং যেখানে ফ্রন্টলাইনার কিংবা মাইগ্রেন্ট ওয়ার্কারদের প্রায়োরিটাইজ করা হয়েছে। পাশাপাশি আমরা দেখতে পেরেছি যে আমাদের যে সম্প্রসারিত টিকাদান কর্মসূচি বা ইপিআই আছে, সেখানের মাধ্যমে আমরা মূলত এই টিকার যে ওয়েস্টেজ ক্যালকুলেশন, সেই কাজটা সেখানে হয়েছে। তো সামগ্রিকভাবে আমরা এর পূর্ববর্তী স্লাইডে এই সূচকগুলির কথা বললাম, পাশাপাশি ওয়েস্টেজের হিসাব, এই সামগ্রিক হিসাব নিকাশের মাধ্যমে আসলে আমাদের সামগ্রিক এই সাপ্লাই চেইন ম্যানেজমেন্টের কাজটা হয়েছে। এক নাগরিকদের প্রকৃতপক্ষে টিকা পাওয়ার ক্ষেত্রে যদি আমরা তাকাই, তাহলে এখানে আমরা রিয়েল টাইম ডেটা ব্যবহারের একটা চমৎকার উদাহরণ আসলে দেখতে পাই, যে আমরা সুরক্ষা পোর্টালে রেজিস্ট্রেশনের সাথে সাথে আসলে একজন নাগরিক তার ভ্যাকসিনেশন কার্ড এবং রেজিস্ট্রেশন নাম্বারটা পেয়ে যাচ্ছে। এবং এই যে রেজিস্ট্রেশনটা হচ্ছে, সেটা কিন্তু সাথে সাথেই আসলে আমাদেরকে একটা কাভারেজ প্ল্যান তৈরি করতে সাহায্য করছে, যেটা কিনা ডিমান্ড এস্টিমেটের মাধ্যমে একটা কাভারেজ প্ল্যান তৈরি করতে সাহায্য করছে। এবং এই কাভারেজ প্ল্যানে এই ডিমান্ড এস্টিমেশনের পাশাপাশি যে আমাদের কোল্ড চেইন ক্যাপাসিটি বা লজিস্টিক্স ক্যাপাসিটি আছে, সেই জিনিসটা ব্যবহৃত হয়েছে। এবং এই সকল তথ্য উপাত্তের উপর ভিত্তি করে আসলে কিভাবে একজন ইন্ডিভিজুয়ালের কাছে এসএমএস পাঠানো হবে এবং কোন সিকোয়েন্সে পাঠানো হবে, সেই জিনিসগুলো ডিটারমাইন্ড হয়। তবে এই ক্ষেত্রে আমাদের কাছে দুটো অবজারভেশন আসলে আমাদের কেআই এর মাধ্যমে উঠে এসেছে। সেটি হচ্ছে যে আমাদের বর্তমান যে টেকনিক্যাল ক্যাপাসিটি আছে, তাতে বয়স ভিত্তিক আসলে সিকোয়েন্সিং সম্ভব নয়, এবং সিকোয়েন্স অফ কাভারেজ আসলে মূলত অকুপেশনের ভিত্তিতে করা হয়েছে। এই দুটি কেস স্টাডির পরে আমরা যদি তাদের অবজারভেশনের দিকে যদি চলে যাই, তাহলে আসলে দেখতে পারি যে এই টিকাদান কর্মসূচির ক্ষেত্রে যে অনলাইন বেস সিস্টেমটা ব্যবহৃত হয়েছে, সেটা অনেক ক্ষেত্রেই আসলে স্বচ্ছতা বহুলাংশে নিশ্চিত করতে সহায়ক হয়েছে। এবং এই যে রিয়েল টাইম যে ডেটা জেনারেট হলো, সেটা আমাদেরকে ডিমান্ড এস্টিমেট করতে সাহায্য করেছে। এবং যেই ভ্যাকসিন সার্টিফিকেটটা অনলাইন মাধ্যমে দেওয়া হয়, সেটা আসলে ইজ অফ অ্যাক্সেসের ক্ষেত্রে একটা বিরাট ভূমিকা রেখেছে। তবে এখানেও যে ইন্টারনেট ব্যবহার করার যে রিকোয়ারমেন্ট, সেটা ওয়ান্স এগেইন আসলে আমাদের কিছুটা ডিজিটাল ডিভাইডের কনসার্নটা তুলে আনে। এর পাশাপাশি এনআইডি থাকার যে বাধ্যবাধকতা, সেটা অনেক ক্ষেত্রে যারা কিনা ইয়াঙ্গার পপুলেশন কিংবা যাদের কোনো কারণে এনআইডি নেই, তাদের টিকা প্রাপ্তিতে কিছুটা বাধা সৃষ্টি করেছে। পাশাপাশি অনেক ক্ষেত্রে আমরা দেখেছি যে তৃতীয় লিঙ্গের যারা মানুষ, তাদের আসলে টিকা পাওয়ার ক্ষেত্রে কিছুটা ব্যাঘাত ঘটেছে। আর সুরক্ষা পোর্টালে আমরা শুরুতে একটা জিনিস দেখেছিলাম যে শুরুতে যখন অনেক প্রেশার ছিল সিস্টেমটার উপর, তখন সেটা বিভিন্ন সময় শাটডাউন হয়েছে, যদিও পরবর্তীতে সেটা কাটিয়ে ওঠা সম্ভব হয়েছে। সো এই দুটো কেস স্টাডির পরে আমরা যখন আসলে আমাদের সামগ্রিক যে মেইন স্ট্রিম ইকোনমিক ডেটার উপরে করোনার কি প্রভাব থাকে সেটার দিকে তাকাই, তাহলে আমরা দেখতে পারি যে আমাদের যে সকল লার্জ স্কেল সার্ভে যেগুলো কিনা মূলত আসলে বাংলাদেশ পরিসংখ্যান ব্যুরো করে থাকে, তার মধ্যে অনেকগুলি আসলে করোনাকালীন সময়ে আমরা করতে পারিনি। যেরকম কিনা আমাদের আদমশুমারি, আমাদের খানা আয় ব্যয় জরিপ কিংবা আমাদের শ্রমশক্তি জরিপ প্রত্যেকটি আসলে এই করোনার জন্য পিছিয়ে গেছে। তবে আমাদের যেগুলো রেগুলার মেইনস্ট্রিম ডেটা, যেরকম ইনফ্লেশন, ইন্ডাস্ট্রিয়াল প্রোডাকশন, ওয়েজ রেট কিংবা ডেমোগ্রাফিক ডাটা, সেগুলো করোনাকালীন সময়েও প্রশংসনীয়ভাবে আসলে আমরা নিয়মিতভাবেই পেয়েছি। এর ভিতরে আমাদের যখন কেআই এর মাধ্যমে আসলে আমি জানতে পেরেছি যে করোনাকালীন সময়ে মূল্য সংক্রান্ত তথ্য আসলে সংগ্রহ করা কিছুটা সহজ ছিল, কিন্তু যেহেতু ডেমোগ্রাফিক ইনফরমেশন কালেক্ট করার ক্ষেত্রে ফেস টু ফেস ইন্টারাকশনের প্রয়োজন হয়, পার্টিকুলারলি আরবান এরিয়া, সেটা অনেক সময় প্রবলেম হয়েছে। এর পাশাপাশি আরো কিছু প্ল্যান্ড ডিবিএস এর সার্ভে ছিল, যেমন লিটারেরি অ্যাসেসমেন্ট সার্ভে, ক্লাইমেট সার্ভে এবং ট্যুরিজম রিলেটেড সার্ভে। সেই সংক্রান্ত কিছু উদ্যোগ আসলে করোনাকালীন সময় আমরা ব্যাহত হয়েছি। আমাদের স্টাডির মূল ফাইন্ডিংস গুলোর দিকে যদি আমরা তাকাই, তাহলে আমরা ইতিপূর্বেই বলেছিলাম যে আমরা আসলে মূলত 6টি হাইপোথিসিসের ভিত্তিতে আমাদের ফাইন্ডিংস গুলোকে দেখার চেষ্টা করেছি। এর মধ্যে আমাদের প্রথম হাইপোথিসিসটি ছিল যে এই করোনাকালীন সময়ে তথ্যপত্র সংগ্রহ এবং প্রস্তুতির জন্য আমাদের একটা ইনস্টিটিউশনাল মেকানিজম এবং সিস্টেমিক একটা সামগ্রিক এফোর্ট আছে। এর ভিত্তিতে আমাদের মূল্যায়ন হলো যে অবশ্যই আমাদের কিছু ইনস্টিটিউশনাল ডেটা ইনিশিয়েটিভস তৈরি হয়েছে, কিন্তু এটা একটা সামগ্রিক এবং স্ট্রাকচার্ড গ্রুপ নিতে পারেনি। এবং এই যে ডেটা ইনিশিয়েটিভস গুলো আমরা দেখি, প্রথমত এগুলোর মধ্যে অবশ্যই কিছু সাপ্লাই ড্রিভেন আছে এবং কিছু ডিমান্ড ড্রিভেন আছে। এবং এই করোনাকালীন সময়ে গভর্নমেন্ট এবং নন গভর্নমেন্ট এন্টিটি গুলোর মধ্যে একটি পার্টনারশিপ গড়ে তোলার একটা সুযোগ প্রদান করেছে। কিছু কিছু ক্ষেত্রে দেখা গেছে যে হয়তো ঊর্ধ্বতন কর্তৃপক্ষকে কিছুটা প্রোঅ্যাক্টিভলি আমাদের পার্সু করতে হয়েছে এই সকল ইনিশিয়েটিভস গুলো নেওয়ার জন্য। দ্বিতীয়ত অবশ্যই যে কিছু ইনোভেটিভ ডেটা ইনিশিয়েটিভস আমরা দেখতে পেরেছি যেটা করোনাকালীন সময় নেওয়া হয়েছে, এবং এক্ষেত্রে আসলে আমরা দুটো অ্যাপ্রোচ দেখতে পেরেছি। যে কিছু কিছু ইনিশিয়েটিভস আমরা ইতিমধ্যে যেসব ইনিশিয়েটিভস ছিল তার উপরে বেস করে তৈরি করা হয়েছে, যেটা কিনা ডুইং বাই লার্নিং হিসেবে আসলে দেখা যায়, কিংবা আর কিছু কিছু আমাদের হয়তো একদম গ্রাউন্ড আপ থেকে ডেভেলপ করতে হয়েছে, যেটাকে লার্নিং বাই ডুইং বলা হয়। তবে অবভিয়াসলি এই সকল ইনোভেটিভ ডেটা ইনিশিয়েটিভস এর ক্ষেত্রে আমরা দেখেছি যে করোনাকালীন সময় ইউজার জেনারেটেড ডেটা এবং টেলিকম ডেটা ব্যবহারের ক্ষেত্রে গুরুত্ব কিছুটা বৃদ্ধি পেয়েছে। আমাদের দ্বিতীয় হাইপোথিসিস ছিল যে আমাদের একটি ইনস্টিটিউশনাল অ্যারেঞ্জমেন্ট আছে যাতে কিনা এই ডেটা ইকোসিস্টেমে যে ডেটা জেনারেট হচ্ছে সেটা ইন্টিগ্রেট, কোঅর্ডিনেট এবং রিকনসাইল করা যায়। তো এক্ষেত্রে আমরা মূলত যেটা দেখতে পেরেছি যে এই সকল ইনস্টিটিউশনাল অ্যারেঞ্জমেন্ট মূলত হেলথের উপরেই আসলে মূলত কনসেন্ট্রেটেড, এবং সেগুলো অন্যান্য আদার এরিয়াতে খুব একটা বেশি স্পিল ওভার হয়নি। এবং এই সকল ইনিশিয়েটিভস গুলো নেওয়ার ক্ষেত্রে অধিকাংশ সময় আসলে একটা গভর্নমেন্ট এজেন্সি সেন্ট্রিক অ্যাপ্রোচ ছিল। কিছু কিছু ক্ষেত্রে আমরা হয়তো হোল অফ সোসাইটি একটা অ্যাপ্রোচ দেখতে পেরেছি। এই ইনিশিয়েটিভস গুলো নেওয়ার ক্ষেত্রে প্রথমত আমরা দেখতে পেরেছি যে সরকারি এবং বেসরকারি সকল ধরনের এন্টিটি আসলে মাল্টিপল রোল প্লে করেছে। অর্থাৎ একই অর্গানাইজেশনের ক্ষেত্রে দেখা গেছে যে তারা ডাটা জেনারেটর, ম্যানেজার বা ইউজার বিভিন্ন ক্ষেত্রে বিভিন্ন রোল প্লে করেছে, এবং সরকারি এন্টিটি গুলোর ক্ষেত্রে একটা কোঅর্ডিনেটেড ম্যানারে আমরা তাদের কাজ করার প্রবণতা লক্ষ্য করেছি। এবং অবশ্যই এর আগে যেটা আমরা এর আগেও মেনশন করেছি সেটা হচ্ছে সরকারি এবং বেসরকারি সংস্থা সমূহের মধ্যে তাদের কোলাবোরেশনটা এই কোভিড-19 অতিমারির পরিপ্রেক্ষিতে আরো কিছুটা জোরালো হয়েছে। এবং যেটা দেখা গেছে যে আমাদের বেসরকারি ডেটা ইনিশিয়েটিভস গুলোর ক্ষেত্রে এটার অ্যাকসেপ্টেন্স সরকারি লেভেলে ক্রমাগত বৃদ্ধি পেয়েছে। এবং একই সাথে আমরা যেটা দেখতে পেরেছি যে এই সংক্রান্ত যে ডেটা ইনিশিয়েটিভস গুলি আছে সরকারের ভিতরে বিভিন্ন অর্গান এবং সংস্থাগুলোর মধ্যে তাদের যে ডেটা সিস্টেম আছে সেটার মধ্যে একটা ইন্টারঅপারেবিলিটি আছে। এই ইন্টারঅপারেবিলিটির একটা চমৎকার উদাহরণ আসলে আমরা এই প্রোগ্রামটিতে দেখতে পাই।
এখানে ডক্টর সাইমা, আপনি ডক্টর সাইমার গোলাম রসুল, আপনি বন্ধ করেন আপনার মাইক্রোফোনটা প্লিজ, ডিস্টার্ব ক্যারি অন।
জি, দ্বিতীয়ত আমরা দেখতে পাই যে এই সকল ডেটা ইনিশিয়েটিভস এর ক্ষেত্রে আসলে একটা ইন্টারঅপারেবল ডেটা সিস্টেমের পরিচয় আমরা পাই, যার চমৎকার একটা উদাহরণ আসলে 2,500 টাকার প্রোগ্রামটা ছিল, যেখানে কিনা আমরা দেখেছি এক এজেন্সির ডেটা কিভাবে পরবর্তীতে আরেক এজেন্সি ব্যবহার করেছেন এবং সেটা এমএফএস ব্যবহার করেছে। এবং কোন কোন ক্ষেত্রে আমরা দেখতে পেরেছি যে বেসরকারি সংস্থাগুলো সমূহ এই ধরনের একটা ইন্টারঅপারেবল ডেটা সিস্টেমের সাথে যুক্ত ছিলেন, এবং এক্ষেত্রে মূলত ডিজিএইচএস এর যে DHIS2 প্ল্যাটফর্মটা ছিল সেটার আসলে উল্লেখ বারবার আমাদের স্টাডিতে উঠে এসেছে। আমাদের তৃতীয় হাইপোথিসিস ছিল যে এই সকল তথ্যপত্র ডকুমেন্ট এবং আর্কাইভিং এর ক্ষেত্রে একটা সিস্টেমেটিক প্রসেস আছে এবং এই সকল ডেটা অ্যাক্সেস করার ক্ষেত্রে রিলেভেন্ট অ্যাক্সেস স্টেক হোল্ডাররা সুবিধা ভোগ করে। তো এই ক্ষেত্রে আমরা দেখতে পেরেছি যে ডকুমেন্টিং এবং আর্কাইভিং যে প্রসেসটা ছিল সেটা কিছুটা স্ক্যাটার্ড ভাবে আছে এবং মাইক্রো লেভেল ডেটা অ্যাক্সেস করার ক্ষেত্রে অনেক সময় বেশ কিছু আসলে চ্যালেঞ্জ পরিলক্ষিত হয়। তো এই ক্ষেত্রে প্রথমত আমরা যেটা দেখতে পাই সেটা হচ্ছে যে গভর্নমেন্ট এবং নন গভর্নমেন্ট উভয়ের ক্ষেত্রেই বেশিরভাগ সময় এই একটা ওয়েল ডিফাইন্ড এবং ফর্মাল স্টেরয়েড সিস্টেম আছে। এবং দ্বিতীয়ত আমরা যেটা দেখতে পাই যে কোভিড-19 সংক্রান্ত যে সকল মাইক্রো ডেটা আছে সেটা অ্যাক্সেস করার ক্ষেত্রে কোনো ফর্মাল মেকানিজম না থাকার কারণে আসলে বেশ কিছু অসুবিধা অনেক সময় অনেকে ফেস করেছেন এবং এই সকল ডেটা অ্যাক্সেস করার ক্ষেত্রে অনেক সময় প্রি এক্সিস্টিং লিয়াজো কিংবা ইনফর্মাল চ্যানেল হয়তো কিছুটা বেটার কাজ করে এবং যেই ডেটা অ্যাক্সেস করার ক্ষেত্রে যে ব্যুরোক্রেটিক লেংদি প্রসেসটা আছে এবং পাশাপাশি যে প্রাইভেসি কনসার্ন আছে অথবা অনেক ক্ষেত্রে দেখা গেছে যে কোনো ডেজিগনেটেড পারসন কিংবা সিস্টেমের যে অভাব আছে সেটা আসলে ডেটা অ্যাক্সেসের ক্ষেত্রে কিছুটা ব্যাঘাতের সৃষ্টি করে। আমাদের পরবর্তী হাইপোথিসিসটা খুব সম্ভবত আজকে আলোচনার পরিপ্রেক্ষিতে সবচেয়ে গুরুত্বপূর্ণ। এই হাইপোথিসিসে আসলে আমরা মূলত যেটা দেখতে চেয়েছি সেটা হচ্ছে যে এই যে তথ্যপত্র সংগ্রহীত হলো বা তৈরি হলো সেটা কি এফিশিয়েন্ট ডেলিভারি অফ ভেরিয়াস পলিসি মেজার্স এর ক্ষেত্রে সহায়তা করে কিনা। এক্ষেত্রে আমরা মূলত দেখতে পেরেছি যে সকল তথ্য এবং তথ্যের উপর ভিত্তি করে বিশ্লেষণ ডিসিশন মেকিং এ আসলে শেষমেশ ব্যবহৃত হয়নি এবং বাই ইন বাই দ্য পলিসি অ্যাক্টরস কিছু কিছু ক্ষেত্রে কিছুটা হয়তো স্লোয়ার ছিল এবং কখনো কখনো আসলে হয় নাই। তো এবং এক্ষেত্রে আমরা দেখতে পেরেছি যে এই ডেটা ইনিশিয়েটিভস গুলো কেন নেওয়া হবে সেই ক্ষেত্রে কিছুটা আন্ডারস্ট্যান্ডিং এর ক্ষেত্রে কিছুটা ঘাটতি ছিল শুরুর দিকে এবং একই সাথে ডিসিশন লেভেল মেকিং প্রসেসে যে মাল্টিটিউড অফ অ্যাক্টরস আসলে ইনভলভ আছেন সেটা অনেক ক্ষেত্রে আসলে পরিস্থিতিটাকে আরো কিছুটা জটিল করেছে এবং ইনিশিয়াল ফেজে আমরা যেটা দেখতে পেরেছি যে পলিসি মেকাররা আসলে এই ধরনের ডেটা ইনিশিয়েটিভস গুলো সেটাকে অ্যাকোমোডেট করার জন্য হয়তো প্রস্তুত ছিলেন না, কিন্তু করোনার যে দ্বিতীয় সেকেন্ড ওয়েভ তার আগে এই অ্যাকসেপ্টেবিলিটি আসলে কিছুটা বেড়ে গেছে এবং একই সাথে বর্তমান সময়ে আমরা দেখতে পেরেছি যে এই সকল ডেটা ইনিশিয়েটিভস গুলো অ্যাকসেপ্ট করার ক্ষেত্রে সরকারের আসলে আরো গ্রহণযোগ্যতা সরকারের তরফ থেকে আরো আস্তে আস্তে বৃদ্ধি পেয়েছে এবং এক্ষেত্রে একাডেমিশিয়ানস বা রিসার্চারও আসলে এগিয়ে আসছে। তবে আমরা দেখতে পেরেছি যে বেসরকারি ডেটা ইনিশিয়েটিভস গুলো অ্যাকসেপ্ট করার ক্ষেত্রে শুরু থেকেই আসলে কিছুটা রেটিসেন্স অন দ্য পার্ট অফ গভর্নমেন্ট ছিল। আমাদের পরবর্তী হাইপোথিসিসে আসলে আমরা জানতে চেয়েছি,
মুনতাসির একটু তাড়াতাড়ি করতে হবে, হ্যাঁ প্লিজ।
জানতে চেয়েছি যে এই যে স্ট্র্যাটেজিস গুলো জেনারেটেড হলো সেটা পলিসি ডিজাইন ইমপ্লিমেন্টেশন বা ইত্যাদির ক্ষেত্রে অ্যাডিকুয়েট ছিল কিনা। তো এক্ষেত্রে আমরা মূলত দেখতে পেরেছি যে অবভিয়াসলি আমরা যে নতুন তথ্যপত্র সংগ্রহ বা তৈরি করেছি সেটা পলিসি অ্যাকশনে কন্ট্রিবিউট করেছে, কিন্তু সকল তথ্যপত্রের চাহিদা আসলে মেটেনি। কিন্তু এর করোনা পরিপ্রেক্ষিতেও যে অব্যাহত তথ্যপত্রের আসলে একটা সরবরাহ ছিল সেটা অবশ্যই অত্যন্ত প্রশংসনীয়, কিন্তু তারপরেও এখানে এই ডেটা সংক্রান্ত কিছু কনসার্ন আসলে রয়েই যায়। এটার অ্যাকুরেসি কিরকম, রিপ্রেজেন্টেটিভনেস কিরকম কিংবা কোয়ালিটি কিরকম। এবং আমাদের সর্বশেষ যেটা হাইপোথিসিস ছিল সেটা হচ্ছে যে বিভিন্ন গ্লোবাল এবং লোকাল এক্সপেরিয়েন্সের ক্ষেত্রে আমরা যদি বেস্ট প্র্যাকটিস গুলো অ্যাডাপ্ট করতে পারি কিংবা অন্যরাও আমাদের থেকে শিখতে পারে। এক্ষেত্রে আমরা দেখতে পেরেছি যে অবশ্যই সেখানে ক্রস লার্নিং এর সুযোগ রয়েছে, তবে এক্ষেত্রে লোকাল কনটেক্সট আমাদের সবসময় মাথায় নিতে হবে এবং নন গভর্নমেন্ট এন্টিটি গুলোকে যদি আমরা স্ট্রেংথেনিং করি তাহলে আমরা এই ডেটা ইকোসিস্টেমকে এক্সপ্যানশনের ক্ষেত্রে আসলে আরো এগিয়ে যেতে পারবো। তবে এই কথাটা আবারও আমি পুনরাবৃত্তি করছি যে গ্লোবাল বেস্ট প্র্যাকটিস আমরা যদি আমাদের অ্যাডাপ্ট করতে চাই তাহলে অবশ্যই আমাদের কান্ট্রি কনটেক্সটের কথা মাথায় রাখতে হবে। এই পরিপ্রেক্ষিতে আমি যদি বলি, অনেক দেশেই হয়তো আমরা দেখেছি কন্ট্যাক্ট ট্রেসিংটা খুব ভালো কাজ করেছে, কিন্তু আমাদের দেশে উদ্যোগ নেওয়ার পরেও কিন্তু কাজটা করেনি। এরপরে আসলে মূলত আমরা এতক্ষণ যে আলোচনা করলাম সেই চ্যালেঞ্জেস কিংবা সেই পজিটিভস এন্ড নেগেটিভস গুলোর একটা সামারি আছে, সেটার বিস্তারিত বিবরণে আমি এই মুহূর্তে আর যাচ্ছি না। আমি পরবর্তীতে যদি আসলে আমাদের এই যে চ্যালেঞ্জেস কিংবা পজিটিভস বা নেগেটিভস আছে এর বেসিসে ভিত্তি করে পরবর্তীতে আমাদের ফিউচার কোর্স অফ অ্যাকশনস কি হতে পারে, তাহলে মূলত তিনটি ইস্যুর দিকে আমরা আসলে আলোকপাত করতে পারি। আমরা কিভাবে আমাদের পজিটিভ ইনিশিয়েটিভ বা সাকসেসফুল ইনিশিয়েটিভস গুলোকে সিস্টেম ওয়াইড অ্যাডাপ্ট করতে পারি, আমরা কিভাবে এগুলোকে স্কেল আপ করতে পারি এবং কিভাবে এগুলোকে সাস্টেনেবল বানাতে পারি। সো সিস্টেম ওয়াইড অ্যাডাপ্টেশন আমরা যদি এনশিওর করতে চাই তাহলে আমাদের কাছে মনে হয়েছে যে একটা ক্লিয়ার ইনস্টিটিউশনাল আর্কিটেকচারের প্রয়োজন আছে, যেখানে গভর্নেন্স এবং রুলস অফ বিজনেসটা কিরকম হবে সেটা আমাদের প্রপারলি ডিফাইন করতে হবে। এবং এই আলোচনাটা অবশ্যই লিগালিস্টিক নেচারের হবে না, এখানে সকল যারা রিলেভেন্ট স্টেক হোল্ডার আছে তাদের ইনভলভমেন্ট প্রয়োজন হবে ডিমান্ড এবং সাপ্লাই সাইড উভয় থেকে। এবং একই সাথে আমাদের কাছে সিস্টেম ওয়াইড অ্যাডাপ্টেশন ক্ষেত্রে মনে হয়েছে যে যদি একটা নলেজ হাব ক্রিয়েট করা যায় যেখানে কিনা সব ধরনের রিলেভেন্ট তথ্য উপাত্ত কিংবা গবেষণা এবং বিশ্লেষণ থাকবে সরকারি এবং বেসরকারি উভয় তরফ থেকে, তাহলে সেটা সহায়ক হবে। তবে এক্ষেত্রে অবশ্যই আমাদের ডেটা স্ট্যান্ডার্ডাইজেশন, রিকনসিলিয়েশন, অ্যাগ্রিগেশন বা ইন্টারঅপারেবিলিটি এবং কোয়ালিটি এই সংক্রান্ত বিষয়গুলোর দিকে নজর রাখতে হবে। একই সাথে ডেটা প্রাইভেসি এবং কনফিডেন্সিয়ালিটি সংক্রান্ত বিষয়ের দিকে অবশ্যই অত্যন্ত গুরুত্ব প্রদান করতে হবে। এবং এক্ষেত্রে ফর্মুলেশন অফ ডেটা প্রাইভেসি পলিসি এবং ডেভেলপমেন্ট অফ ডেটা শেয়ারিং ফ্রেমওয়ার্ক খুব বেশি গুরুত্ব লাভ করবে। আমরা যদি স্কেলিং আপের দিকে তাকাই তাহলে আমরা যেটা মনে করছি তাহলে যে আমরা যদি আরো বেশি সেক্টর বা ইস্যু কিংবা আরো বেশি স্টেক হোল্ডারকে এই প্রসেসে যুক্ত করতে পারি বোথ উইদিন অ্যান্ড আউটসাইড দ্য গভর্নমেন্ট, তাহলে স্কেল আপের দিকে আমরা বেটার আগাতে পারবো। এবং এই ক্ষেত্রে যদি আমরা একটা ডেটা কমিউনিটি ফরমেশন করতে পারি, যেটা একটা ফলো আপ সোসাইটি অ্যাপ্রোচ ফলো করে হবে, সেটা এই ক্ষেত্রে কিছুটা ইউজফুল হবে। এটা একই সাথে আমাদের ডেটা সিস্টেমে যে ট্র্যাডিশনাল সাইলো গুলো আছে সেগুলোকে ওভারকাম করতে সহায়তা করবে এবং পাশাপাশি এগুলো যে নন গভর্নমেন্ট এন্টিটি গুলো আছে তাদেরকে একটা মেইন স্ট্রিম ডেটা ইনিশিয়েটিভে ইন্টিগ্রেট করতে সাহায্য করবে। এই ডেটা ইনিশিয়েটিভস গুলোকে যদি আমরা সাস্টেনেবল করতে চাই তাহলে অবশ্যই ফার্স্ট এন্ড ফরমোস্ট আমাদের অ্যাডিশনাল রিসোর্সেস লাগবে, বোথ ফাইন্যান্সিয়াল, হিউম্যান রিসোর্স এন্ড টেকনিক্যাল। এবং এটা পার্টিকুলারলি আমাদের নন গভর্নমেন্ট এন্টিটি গুলোর জন্য বেশি পার্টিনেন্ট, যাদের হয়তো সেই রিকোয়ার্ড রিসোর্সেস গুলো অ্যাডিকুয়েটলি নাই। প্লাস একই সাথে আমাদের কাছে যেটা মনে হয় যে আমরা এই করোনাকালীন সময় আমাদের যে লার্নিং গুলো আছে সেগুলোকে যদি আমরা ভালোভাবে ব্যবহার করতে পারি, যে আমাদের এক্সিস্টিং ইনিশিয়েটিভস গুলোকে আরো একটু শক্তিশালী কিংবা আর একটু মডিফাই করার জন্য, তাহলে সেটা আমাদের ওভারঅল ইকোসিস্টেমটাকে সাস্টেনেবল করতে সহায়তা করবে। আমরা উদাহরণস্বরূপ যেরকম বলেছি, এই যে আমরা রিয়েল টাইমে হেলথ ডেটা জেনারেশনের এত উদ্যোগ নিলাম, এটাকে যদি আমরা কন্টিনিউ করতে পারি বা কিছুটা এক্সপ্যান্ডও অন্যান্য জায়গায় করতে পারি তাহলে সেরকম একটা হতে পারে। এর বাইরে আমরা যদি অ্যাডমিনিস্ট্রেটিভ ডেটা, ইউজার জেনারেটেড ডাটা বা জিওস্পেশাল ডাটা, এই জিনিসগুলি যদি আমাদের যে এনএসও ডিবিএস আছে তারা যদি ব্যবহার করে, তাহলেও কিন্তু আমাদের ট্র্যাডিশনাল যে ডেটা কালেকশন অ্যাপ্রোচ সেগুলোর থেকে হয়তো আমরা বের হয়ে অন্য হয়তো আর একটু আপ টু ডেট ডেটা দেওয়ার ক্ষেত্রে আমরা এগিয়ে যেতে পারি। তবে এই তিন ক্ষেত্রেই আসলে যে জিনিসটা মনে রাখতে হবে যে পলিটিক্যাল বাই ইন এখানে খুবই গুরুত্বপূর্ণ। এবং এই করোনাকালীন সময় আমরা দেখেছি যে ডেটা ব্যবহারের মেন্টালিটির ক্ষেত্রে আসলে আমাদের অনেক উন্নতি ঘটেছে, কিন্তু তারপরেও আমরা যারা ডেটা জেনারেটর আছি কিংবা আমরা যারা নলেজ কমিউনিটি আছি আমাদের প্রচেষ্টাটা অব্যাহত রাখতে হবে। এবং এই কাজটি করার জন্য আমাদের যে এক্সপেরিয়েন্স আছে সেটা ডকুমেন্ট করা, আমাদের এই পজিটিভ এক্সপেরিয়েন্সের যে ভালো ইম্প্যাক্ট গুলো আছে সেই জিনিসগুলোর সপক্ষে এভিডেন্স জেনারেট করা এবং সেগুলোর বেসিসে একটা সামগ্রিকভাবে মাল্টি স্টেক হোল্ডার অ্যাপ্রোচে অপিনিয়ন বিল্ডিং করাটা খুবই জরুরি হবে। আমার তরফ থেকে আজকে প্রেজেন্টেশনে এতটুকু ছিল। থ্যাংক ইউ।
Thank you, Muntasir, for that presentation. Colleagues, the PowerPoint has been uploaded. You may find that in the chat box, those who want to access that, particularly Shangbadik Bhai Bonera, the media people. I will be inviting the discussants in some order. And I just wanted to mention that a number of issues have been highlighted in the study, starting from the mapping exercise, the taxonomy. Abrok, Sarwar Kar microphone khola ache, please mute karen.
Sir, we're looking for it.
Please do.
Okay, sir.
And the issue which is coming up, that if you look at the last final thing, that we did make progress. We do have a task in hand to consolidate those achievements. But the final point which comes out, that there are at least three types of problem. One problem is the technical problem. How do you really collect the data on time and make them technically usable, credible, interoperable, all these things? So one part of it is that. The second part of the problem is institutional. that which institution does what, because it is not it is a system-wide issue. So, and how they go to coordinate among themselves, and more importantly, they will have to collaborate with the private sector also. The private entities are now in the game. So first is the technical problem, কারিগরি সমস্যা আছে, দ্বিতীয়ত প্রাতিষ্ঠানিক সমস্যা আছে, but third problem, which is the political problem, which is we are talking about here, the political buy-in, এটা শেষে আমরা বলেছি যে এইখানে আমরা যেটা দেখতে পাচ্ছি যে যেটা আমাদের সবচেয়ে বড় বিষয়, যে ডাটা ড্রিভেন পলিসি মেকিং, তো তথ্য উপাত্ত নির্দেশিত পথে সিদ্ধান্ত গ্রহণ, এই জায়গাটাতে আমরা সবচেয়ে গুরুত্বপূর্ণ বলে মনে করছি। এবং এই জায়গার ক্ষেত্রে যে সমস্যাটা দেখা যাচ্ছে সেটা অনেক ক্ষেত্রে মনোভঙ্গির সমস্যা, মাইন্ডসেট প্রবলেম, অনেক ক্ষেত্রে আধুনিক জ্ঞানের প্রবলেম, অনেক ক্ষেত্রে দে ডু নট হ্যাভ দোজ কাইন্ড অফ এক্সপোজার টু এক্সপার্টিজ, এইটার একটা সমস্যা। আবার অনেক ক্ষেত্রে তথ্য উপাত্তের ব্যাপারে ভীতিও থাকতে পারে, যে এই তথ্য উপাত্ত যেটা আসবে সেটা দিয়ে আমার যেই ধরেন যে রাজনৈতিক বক্তব্য আছে তার সাথে এটা খাপ খাবে কিনা সেইটাও থাকতে পারে। সেহেতু এখানে রাজনৈতিক চিন্তার ক্ষেত্রে আমাদের এই তিনটি জায়গাতেই মনোভঙ্গির পরিবর্তন, তাদের যদি কোনো ভীতি থাকে সেটা সরানো, এবং যদি সক্ষমতার কোনো জায়গার ঘাটতি থাকে সেগুলোকে মেটানো ইজ ভেরি ভেরি ক্রিটিক্যাল। তো আমি আর আপনাদের সাথে কথা বলবো না, এবং এটার সাথে অবশ্যই সুরক্ষার বিষয়টি খুবই গুরুত্বপূর্ণ ভাবে আসবে, এবং একটি তথ্য ভান্ডার সৃষ্টি করার বিষয়টিও গুরুত্বপূর্ণ ভাবে এসেছে। থ্যাংক ইউ ভেরি মাচ কলিগস। আই ওয়ান্ট টু লেট ইউ নো অলসো দ্যাট উই হ্যাভ নাম্বার অফ কলিগস have joined us from outside Dhaka. Those who have joined here, please put আপনারা ইয়েতে কি বলে চ্যাট বক্সে আমাদের জানান দেন। আমি দেখছি এখানে যে লিটন সরকার এসছেন, ওনার হলো উন্নয়ন সংঘ, তারপরে আমার জামালপুর থেকে কলিগসরা এসছেন, IEC DCR এর ডক্টর রিপন বড়ুয়া আমি দেখতে পাচ্ছি। So এখানে Mr. Faisal from the Asia Foundation has already put in his comments. Please আপনারা please actively use the chat box, এবং আমরা শেষের দিকে we will try to refer to some of them. Mr. Faisal should also come on board when we open up the discussions over there. We have a number of eminent people also over here. I can see number of them. Mr. Siddiqui, of course, is a regular participant, and many others are over here from the PBS and other. আমি আপনাদের যে তিন চারজনকে এখানে নিয়ে আসবো, they will be coming various sections of the the data ecosystem. Some of them are generators, some of them are assessors, some of them are users. So a feedback loop we will try to capture. So over there. So let us start. Anir, are you ready? Tawfiq? And I want to recognize the presence of Professor Mustafizur Rahman, the former executive director and the current distinguished fellow of CPD. Mustafiz, thank you for joining. Anir, are you ready? Anir Chaudhary from A2I was also doing a parallel session. If he is ready, I would have loved to start with him.
Anir has requested for some time.
He has requested. Is Dr. Zakir here?
So Dr. Zakir has also requested for 5 more minutes. So we have Morshid Appa with us.
I wanted to start with other people. Then
Dr. Zakir is here. I understand.
Dr. Zakir is here. Dr.
Yes.
Zakir is the working group member of the Bangladesh Health Watch. He is an eminent scientist, epidemiologist. He had been in the health sector for quite some time. He is an institutional memory for many of us. So let me start off with Dr. Zakir Hussain. And you have your 5 minutes. So I just wanted to know that how do you really assess our achievements and our challenges? That is the point. And what are the major focus for us is that how do we use these initiatives for data-driven policymaking? Thank you. Please.
Thank you, Dr. Bhattacharya. I'm sorry. I'm not very well prepared today, but I'll try to keep myself within 5 minutes as you have requested. So what I'm planning to do is point out to some of the findings that I gleaned from your report, and then point by point I'll give my comments. So I'll refer first to your part of the report and then give my comment. First is the report has given some discuss about some process indicators. For example, availability of vaccine. On this, my comment is we really haven't assessed market potential, international market potential, and then how much, in fact, is being produced globally, the vaccine being produced, and how much is in demand, and how much we can procure, and at what price. So the procurement was not very seamless, I would say. Competing global, regional country needs, and COVAX capacity were not. COVAX, for example, was supposed to give 2 billion doses, but as of now, it cannot give more than 1.5 billion, and it runs short of $700 million and provide vaccine to different countries. And that, I don't know if that has been taken care of ever. Then Shuroka based registration and vaccine administered, and then estimated volume of vaccine that will be required. We have seen mixed signal on this. Particularly, I'm not personally very sure if when we say 80% of the people will be vaccinated, that is 80% is of 17 crore or all the adults, or as of now above 12%, above 12 years of age. So that
Dr. Zakir, may I interrupt you for a minute? Is vaccination plan ambition level, to what extent it is a data issue? That's what I want to ask you.
Data, yes, it's a data issue. Is unless you really fix up your target, we cannot estimate how much will be the vaccine required. So that is in that count, in that way. So availability of logistics, we have seen. We get the report of RT-PCR, for example. I'm a little going technically. So RT-PCR test is gold test. The reports are given. Data is stored in the form of what percentage of people were RT-PCR test. But the RT-PCR test that is being used in Bangladesh, there's a threshold of we say threshold cycle of how many cycles RT-PCR will process the sample for. That goes beyond the international procedure. So the RT-PCR data that we get, positive data, probably is overestimated. And then the daily coverage of vaccines and estimated daily coverage of prioritized group. The prioritization we have seen shifting. First, it was elderly people, and then who were comorbid, and then it came to migrants, and then it came to university and medical students. Now it is children above 12 years of age. So that has been shifting. Then these hotspots, which location should get more vaccines, allocation of vaccines. That was, as you have rightly pointed out, was not strongly need-based. So I would say the same vein that the load of the disease was never in Bangladesh assessed. The test positivity rate is not prevalence or incidence rate. We in Bangladesh do not know, in fact, what percent of people have been infected or got cured per, say, 1,000 people, for 100 people, for 100,000 people. So that random survey was never done in Bangladesh. And then 3 points on recommendation that your report has given. One is the endeavor to sensitize policymakers regarding the usefulness of data and use. In fact, for example, this data in particular is not available on there was no pharmacovigilance of people who are being vaccinated. What is happening? What is happening to the people who have been vaccinated? What is the side effect? Vaccine is given, half an hour observation is done, and they are released from the vaccine site, and never ever any more follow-up is done. But in fact, follow-up will be done at least for 14 days. And for mRNA vaccine, there are people who urge that it should be done for 7 years. So these are never talked about in our policy level. And then I think last one is build opinion by engaging stakeholders. I'm not talking about other stakeholders, but in clinical field, there were 40 committees, 40 plus committees formed, 5 or 6 of which were functional. And now only the national technical committee functions, but then no engagement beyond that has ever come into practice. And the committees, in fact, do not. I don't know if how much they understand the database decision-making process, or how much they are assessing the different kind of data, global data, regional data. I don't think really they are taken into consideration. So I believe I should end here. Thank you very much.
Okay, thank you very much, Dr. Zakir. As usual, your experience shows up. 3 points I have noted. One is the issue of the use of data in the vaccine procurement and management, and the demand supply issue management on that. The second one is, of course, the post-vaccination vigilance issue, surveillance issue. And the third one is the stakeholder engagement, particularly the clinical people and others. The 3 points I have noted from there.
If you kindly allow me just one point.
Yes.
There were 5 or 6 studies done in Bangladesh on protection level, immunity level, and prevalence. All of these are non-random and purposive sample-based studies, which can be generalized, which suffer from external validity.
Yeah. Thank you very much. I would request all of you, those who are not speaking at this moment, please mute yourself because it is creating a bit noise and a bit of a distraction. I understand this is a technical issue, but please try to do that. Having heard a person who is on the field actively using these things, let me invite, is Anil ready now? Tawfiq?
No, I think he will notify us.
So then let me bring in 2 very eminent people. Both of them are in hands-on as a researcher, analyst, and also a policy-oriented academic. I'm going to call upon 2 experts. One first is Dr. Morshada Chaudhry, and then followed by Professor Rumana Haq. Dr. Morshada Chaudhry leads the BRAC's Health, Nutrition, and Population Program, which had been very, very much engaged both on the practical side and also on the information analysis side. So I'm very pleased to have Morshada with us today. Dr. Morshada Chaudhry. শোনা যাচ্ছে না রে?
Can you hear me now?
Yeah, it's much better now.
Okay, yeah.
Thank you.
Sometimes it happens. Okay. Yeah, so is there any particular question for me?
No, I think what will be interesting for many of us that the BRAC has been on the field, both in terms of the mitigation program, vaccination issues, and etc. So what is the data experience and how do you see being reflected, not in only our study, but we want to move forward. So if you have any constructive suggestion that will be useful, building on a non-government organization which has been embedded in this process, please.
Thank you. So I'll be a little bit general because I have been feeling, I was thinking that how to make the whole data system workable and functional for everyone. This is not something very easy task. This is difficult task, but Bangladesh has done commendable thing during this, over this pandemic. So I would just like to congratulate first the DGHS A2I, and then I'll start my recommendations. So there are a couple of areas where we should now concentrate, because we have done the groundwork. So why we need data? So we need data to give us information. Data is some numbers, but it gives some information when it is analyzed for particular person. So for a manager, the analysis is something different, and for a policymaker is something different. So the analysis should be done at the repository level. You talked about data hub or repository. So where the data is coming in, from there, the data should be analyzed the way that the targeted analysis should be done. So the analytics is very important, and I think we are little bit unexpert there. We need expertise in those areas to help ourselves to target some people and use data to develop into information, because data needs to transform into information. And after that, the person for whom we will who is using the data, they have also to have data literacy, because we have seen that many people have access to data, but basic data literacy is required to understand the data and to handle the data. So the plan is that now I'm going to the top level. I have talked about mid-level. So a strategy should be in place about the whole process, and where community and facility and all data should be integrated together, interoperable. And for being interoperability and to track one person, one individual taking healthcare from everywhere, we need a unique ID or something to track one person, because we found from this study that people are going many places and data duplication is happening. So to tackle this,
Morshada, may I interrupt you? We all agree that we need a unique ID. Is it one which is universal for a citizen, not specific to this health issue, but also it will be related to our tax, our social security, and the support system which the government uses? Are you talking about that, or you are talking about only related to health?
No, that could be one thing that is we can use national ID as well if it is acceptable in the national health system. So we have to think about one system that is like applicable in a private hospital, pharmacy, or even in a law pharmacy or law firm. So wherever, one ID. So and then comes the technical part, where we are really struggling. That we have the money and we have the intention, we have the plan, but who is going to help us with all the technical expertise? That is extremely scarce in Bangladesh. So the hardware and software support in Bangladesh in terms of developing the whole architecture, who will ensure the data quality, data privacy, security, those things we have to take help from outside, I guess, from now to develop the whole system.
Morshada, please hold on for a minute. I think this is an issue I will let her take to the secretary, Dr. Shahnaz, on this, and also the DGBBS, and if there was anybody from the MIS, DGIS, I would have taken that. Would you really think that we need some technical expertise to replenish our current national capacities in order to move forward? I will come back to this issue, but this is a specific issue to my policymakers who are sitting in the hot seat. Please, Morshada, please proceed.
Okay. And finally, I will come to that one strategic issue, that the expertise is not equitable. Some of the bigger organizations have developed their own expertise, but the small organizations, they are lagging behind. So we have to invest on them, and to invest on them, we need money. So we have to make investment case. I think so far we haven't made a good investment case that return of investment could be good if we invest on data. So this is not something.
Moshada, what type of organization you are referring to? This investment in what type of organization?
To every organization, because data is used by every organization. Every organization should generate data, and that data is, I'm talking about, is digitalization basically. So all organizations should be digitized and connected some way with some unique ID, so that every one person either take healthcare or any kind of thing should be like connected in somewhere. So this is like sounds like far-fetched dream, but there should be somewhere we should start. So I think this is the point, as we have started to talk about. So we have to have the strategy in place, but we could start from the bottom, but we could go there. So I think that is our dream, to go there, that where one single ID could give all the information of one person wherever he or she goes. So I think, yeah, I'll stop here.
Thank you, Moshada. I've listed down 4 points from your intervention. One is the analysis should be done at the repository level, the basic analytics on that, on the data repository level. 2, you have strongly argued for a system-wide approach based on a unique ID, and NID could be one of those. 3rd, you say in order to take that forward, technical expertise is necessary, both on the soft and the hardware sides. And 4th, which is possibly no less important, is that while doing all these things, we should ensure equity and capability development across the system, particularly with the smaller organization who may not have resources to do that. Thank you very much. I think
and
so that
investment.
Investment, that is the equity, the sense that to ensure that equity, we need to do the investment in this smaller organization as well. Thank you very much. Those are very profound. Very profound. Let me bring in Anir, and then I will bring in Rumana, because if you are Professor Rumana Hawk, would you kindly wait for a minute, because let Anir address some of the issues. Anir Chaudhary had been in the hot seat, and then you can also respond to some of those issues he may be raising. Is that okay, or you want to speak now?
No, that's fine. She could go ahead. I can wait. Not a problem.
No, I want her to respond to critique you after you have made your presentation.
Okay.
Yes, because I don't want to give you the last floor. Anir Chaudhary. Anir Chaudhary, as you know, is the person in the A2I, the public face of A2I, and had been, as I say, in the hot seat and actively involved, and he could have taken the whole seminar out from our time. But nonetheless, I will give him 5 to 7 minutes to respond to the way forward as much on the critique which we have done. Thank you. Anil.
Brother, thank you so much. Distinguished guests, speakers, participants, and delegates. Sorry that I came a little late. I was able to go through the presentation and heard part of it. I think the presentation is fantastic. The area that it covered and the analysis that it has done, it's actually brought up some very key points. I'll talk about maybe 3 or 4 things. The first thing I would suggest is, I think there is a bit, thank you.
Yeah, please, now it's better, please.
Can you hear me properly?
Yes, very much.
Okay, thank you. Yeah, so the first thing I'd like to talk about is, again, thank you first of all, the mention of A2I, the work that we have done with DG Health, IDCR on the health side, and also with a number of organizations within the government to develop the COVID recovery dashboard. So I think the dynamic dashboard has already been mentioned. It's mentioned as DG Health, but A2I actually has done the major work, so there could be attribution for that. And the recovery dashboard, I think, is something that you may want to, again, talking to Mr. Kamal, you may actually want to look at. So this is an emerging area where we're looking at remittance, we're looking at education, we're looking at many other parameters. And this is being guided from an SDG lens with specifically the the chief SDG coordinator, principal SDG coordinator from the Prime Minister's office. So she's guiding exactly how this will evolve. So this is a growing area which would actually help this analysis as well. As far as telehealth is concerned, in terms of preventive and recovery areas, so there are 4 telehealth systems that are emerging, sort of in parallel. One is the COVID telehealth. Second is the MA telehealth. Third is the 333 telehealth, and the fourth that has always existed, 16263 of DG Health. So these 4 actually provide good repository information, and we have researchers from several universities, both Bangladeshi and international universities, particularly Columbia, who are looking at analyzing this data. So, for instance, there is a paper being written on reinfection. So, because we have massive amounts of data in the COVID telehealth system, we can actually figure out how many reinfection cases have happened. So things like that. So I think that would give you even more insights. I would suggest that looking at those. Now let me talk about a few of the things that maybe Morsheda talked about.
Anir, I just wanted to remind that these are all important. We didn't cover many of them. We had a cutoff mark in terms of where we want to say, because this is a moving frontier. There is no end to the things which are happening.
Absolutely.
Okay, please go ahead.
Just wanted to mention these are possibilities for the next study, perhaps. Morsheda talked about something very important, and that is personification of data. So a data is always attached to a person in the way we're talking about it as far as health is concerned. But then that person is not only a patient, but also a student or a parent or a loan receiver or has a profession. So from that standpoint, that person is identified by different government agencies and private sector organizations differently currently. So NID is the single thread that binds them together, but NID is not enough because NID is only applicable to the adults. So anybody who's below the age of 18, although the NID law talks about the information capture for all citizens. So anybody who is below 18, anybody who's not a citizen, what happens to them? What happens to the expatriate population? What happens to the displaced population, such as the Rohingyas? So I think we need to think holistically. So we need some sort of an ID. We are calling the unique ID, UID, and that's being developed with the sponsorship and guidance of the National CRVS Steering Committee, Civil Registration and Vital Statistics Steering Committee, headed by the Cabinet Secretary. So that has 25 members, about 18 secretaries within it, and obviously our chief guest today, Dr. Shahnaz Arifin, when she was at Cabinet, she actually facilitated a lot of that conversation with the Cabinet Secretary, but now she's the Statistics and Informatics Secretary. She has a very, very critical role there in the CRVS conversation as well. So when CRVS actually fully functions, we'll see a merger of birth registration and national ID, and all IDs, all citizens' IDs will be actually tied to this UID. It will take a little bit of time, and it will actually bring everything together. Right now, the way we're trying to do is to link birth registration and national ID together by having the national ID system, because that has a very strong number generator, to generate the birth ID as well, birth registration number as well, so that at birth you get the national ID, and that carries you throughout your life from birth to death. And this is also going to be used for immunization. So right now there is no immunization ID, but we want to actually track immunization through that ID. We're also working with Gavi, the Vaccine Alliance, DG Health, and this organization called ID 2020 in the US, to look at the possibility of child biometric, infant biometric impact. So when that happens, you get a biometrically verified UID at birth, during birth registration, or during immunization. So that'll be a huge breakthrough. That initiative will start very soon. We've sort of gotten the funding for it, and that should start with ID 2020's support very soon. Now, let me talk about the thinking around data that is really shifting within the government. I think that's very important. And I will draw from my experience in the World Data Forum. And Devapurda, you were there, you facilitated conversations, you actually are part of that shift in thinking as well, very much as a leader. So if I contrast between 2018 World Data Forum and 2021 Data Forum, I saw two significant changes. One is the source of data. And one thing that I saw was that many more sources are being opened up, and the NSOs from many different countries are open to considering this possibility. So that's an important thing. So data from telcos, I think Mr. Kamal talked about the telcos, data from social media, data from many different user-generated sources as authenticate source of information, how to capture it, how to analyze it, how to visualize it, how to channel that into important statistics. Those are policy decisions that we have to make. But I saw a distinct difference in thinking from the NSOs between 2018 and 2021. So I think that's a big step. Another thing that I think primarily driven by COVID is the distinction between data accuracy and data responsiveness. I think COVID has taught us that responsiveness is often far more important than accuracy. Perhaps the traditional models of sampling and surveys and analysis may actually leave the responsiveness parameter of the equation behind. So I think COVID has taught us that sometimes it's important to be responsive, perhaps with a 20% margin of error, because that gives us today's data for today's decision. Otherwise, if we actually use last year's data for today's decision, it just doesn't work in a world that is volatile and moving really, really fast. I think that's something important to think about, and we should really incorporate that in our national decision making, especially headed by our NSO. So our DG is here, our Secretary of Statistics here. I think they will have a very, very important role in this transformation. There is a project between A2I, BBS, and the UNRC office called Data for Now, and that is looking at exactly these issues. So data sources, for instance, telco data for poverty ranking. So that's one experiment that we saw done in Togo with technical support from University of California, Berkeley, a professor who's developed an artificial intelligence algorithm that shows that using telco data to do poverty ranking reduces both inclusion and exclusion errors. And we're actually about to do that. We are getting permission from the BTRC to do this with 100,000 population size in an anonymized way. So we keep privacy protected. So that's another important thing. I think several of you talked about how when we use personal data, we have to protect the privacy. And when we deal with this kind of massive amounts of data, big data from many different sources, we have to protect the privacy. I'll end with something that happened very, very recently, just earlier this week. Honorable Secretary for Statistics Informatics Division inaugurated the first workshop on data leadership within the government. The idea is that it's not just the NSO, but all different data producers across education, healthcare, social safety nets, disaster management, all these. So we gathered the first cohort of 20 people, and we started this process, 20 plus people, yeah. And we started this process of data leadership with a view of how Bangladesh civil service would look like in 2041. So that's a program that A2I started earlier this year. We call it the Civil Service Leadership 2041, view of mid-level and senior civil servants who will lead the country for the next 20 years. So data leadership is a very, very important component of the Civil Service 2041. And we're looking at different types of data sources. We're looking at different levels of visualization that speak to policymakers. Often visualization not done in the right way only speaks to statisticians, but not to policymakers. So that is a trend that we're trying to develop. We worked with the Health Ministry and DG Health specifically to develop some sample visualization techniques in the last 2 to 3 years with an organization called Vital Strategies, New York. So that has some sample. We worked with the Singapore National University in 2019 to develop 8 prototypes across many different ministries. We started with 200 civil servants, and ultimately 58 of them developed 8 data projects on specific things. And I talked about that in that inauguration as well. So that transformational thinking of what type of data, how to use data, how to make data speak to policymakers, and ultimately that change from survey type thinking to using administrative data, user-generated data, satellite data. So all those things in our policymaking and being responsive rather than so-called accurate, I think is really the transformation that we need. And I think there is a lot of movement within the government. Thank you very much.
I think, Anir, your last observation is very relevant to researchers like us who really look for accuracy, sometimes at high cost and also at a bit delayed in the responses. But thank you very much. I have written down 5 summary points from your intervention. The first one is you alerted us to the changing landscape in the institutional processes what are happening. So the recovery dashboard issue, obviously we were looking into it. But the 4 COVID basis activities which you have mentioned, that is one. The second one, in connection with Morsheda's observation, you mentioned about the personification of data and assured us an unique ID, which is beyond the NID, is being developed currently under development with the CRBS steering committee in the leadership in that way. That's with the cabinet secretary in charge. The third issue was that the infant biometrics, the one with the Gavi and ID 2020, which is interesting. And the fourth issue was that your emphasis on responsiveness vis-a-vis accuracy, and if 20% discount factor, but still
that's
it is
an arbitrary number I used. So don't.
No, I am going to quote you for the 20%. And so on the response, and finally, which is much more reassuring, the data leadership within the government, and which is happening going beyond the BBS, but with BBS in doing the important things, and many new sources of data that have been coming in. I fully appreciate your point that the shift in data ecosystem, in the mindset of the NSOs, they are increasingly overcoming their initial reluctance or reticence and opening up to the new data sources, and particularly telecom data, social media data. I would think credit card data and other things over there. So this is a thing to follow up in that way. Thank you very much, Anir, for those responses.
Can I take 10 more seconds if you allow?
Yes, please.
Sure. So I didn't really want to use accuracy versus responsiveness. I mean, they're both important. I mean, billion-dollar businesses.
But you did a trade-off, huh? You did create a trade-off between the two.
Sure. Sometimes you have to create. But then, if we use telco data for poverty index, for understanding poverty versus doing a survey, which is really the gold standard, perhaps.
Yeah.
And if Togo can show that you can reduce inclusion and exclusion or using that approximation, then which is more accurate? That's also something we need to discuss, right?
And there are statistical methods also to bring up the things, and also triangulation and other issues. I'm sure our more statistical experts and the data experts sitting in the hot seats will be able to respond to some of these issues or the trade-offs we make. Professor Rumana Haq from Dhaka University, she had been doing health economics for quite some time and has done a lot of applied work in this area. And I've always found her interventions very, very thoughtful and insightful. And I'm holding her till the end. Dr. Rumana Haq.
Thank you so much. First, I would like to thank the organizer for inviting me in this very important discussion, and also would like to congratulate the presenters for the excellent presentation. I will very briefly try to identify a few challenges in our data system, data management, but mainly focusing on the health sector because that's my specialty of work, and also from my side a few recommendations for future work. Before going to that, for the presenters, I have one request for the future work, that when the country has been selected for comparing, I found it very interesting, and especially Vietnam and other countries, I think there are lots to learn from them. So for future work, my request is to look into the health expenditure of different countries, and also out-of-pocket health expenditure and the contribution of the government in the health system or health sector, and following those criteria, select a few countries which we can take as a model. And I would like to highlight the case of Sri Lanka, who are really doing great, and maybe having the same or more or less same system, maybe there are lots to learn from them. And Vietnam is doing very good, and we can also consider Thailand or India, just to see the comparison. This is just a very minor comment for the researchers. Now, I would like to say a few points for overall data management, data system. COVID has shown us that real-time data is so important for policy making. And I always say that like demographic and health survey data, global adult tobacco survey data, those we really use for regular policy making. These never comes on time, and there is always 3 to 4 years time lag. So that really makes the data usability in question. So I think we have to have the platform where we get regular data. And when we talk about the data, definitely we consider service data. Well, we have lots of work, but the last speaker who rightly mentioned that who is going to use the data? It's definitely the policymakers, and they need data on human resources, availability and functionality of equipment. They need data on finance. They need data on procurement. So all these data should be collected and real-time data so that this can be used for planning. And also we have to remember that we need to monitor sustainable development goals. So the way we prepare the operational plan in the health sector, we have results framework and we have indicators for that. For each operational plan, there are 29 operational plans. Now there are 31 operational plans in progress. So these indicators are often not in line with sustainable development goal indicators. So we focus on operational plan level indicator and collect data focusing those, but that doesn't help sometimes to monitor SDG indicators. So there needs to be some alignment, and data should be collected for those indicators, which will help to monitor SDG indicators as well.
Professor Rumana, let me intervene a bit. How many operational plan you are mentioning? More than 30?
There are 29 operational plans for the fourth health sector program, but now for the forcibly displaced Rohingya population, we are proposing one more operational plan, so that becomes 30. There are community-based health care operational plan that has been divided into 2 now, CBHC and another is Upazila Healthcare. So altogether now 31 operational plans.
So did you do an assessment of data deficit for operationalizing the operational plans?
Not per se, but definitely I would like to respond in a way that when we do strategic investment plan, program implementation plan for the sector, or even healthcare financing strategy, health workforce strategy, when we do the policy and strategies, we do lots of exercise, we analyze different data. But when we translate those policy into practice and translating these into activities, I think there is the gap that there is lack of capacity that how to translate those policy into practice and ultimately translating into the budget. But because ultimately what we get is the budget and use that for carrying out those activities. So there is a gap of capacity and also translating that. So definitely, I would say there we need lots of capacity to analyze this data. And I want to highlight one point is the policymakers or those who are making the program and those who are preparing the budget. These are 2 separate groups. So those who are making the budget, they doesn't have understanding of how to use this data. And there is less coordination between these 2. So definitely we have to develop the capacity, those who are active workforce for the budgeting and those who are program personnel. So going back to some other points, Dr. Morshida mentioned a number of very practical points. I want to highlight a few of those as well, because in the health sector, for example, family welfare assistant from the ground level and sub-assistant community medical officer, they both are collecting some data. So there are duplications. So when the report is generated, who is going to monitor and see that there is no duplication? And I can give a number of examples. From the ground level, we collect data. Even for the TB control program, NGO partners are collecting the information and also government is collecting information. We have to make sure that there is no duplication. Just giving some examples. It's also important that some definition, operational definition sometimes is not clear for very basic, for example, antenatal visits. As whether it is the first visit, 4 visit, third, how we consider antenatal visit. So whoever is collecting this service data from the ground level, they have to have clear understanding of these definitions. We sometimes feel that, okay, these are very clear, but unless we clarify all the variables and set standard for all these, it is very difficult for them to collect accurate data. Very quickly, there are still parallel system, other distinguished panelists already mentioned, but we have DHIS2, we have EMIS for DG Health, DG Family Planning, we have community-based healthcare, they have their own data system as well. So we need to synchronize all these, and data sharing across these partners is really important, which sometimes doesn't happen. So what I propose is that there should be a high-level interministerial steering committee, which can be formed, for the representatives from Ministry of Health, which also should include DG Health, Family Planning, Medical Education, Nursing Administration, DG DMAB, and other relevant in IEDCR. And outside,
you are meaning, Professor Hawk, you are implying a steering committee at the health ministry level or the system-wide?
System-wide, and there should be represented from BBS, ICT, and cabinet division if needed, and also private sector and think tanks maybe. So a high-level steering committee who will look into these and try to create a single platform, because we all are saying a surveillance system, a single platform where all the data will be pulled into. There definitely we need an e-health act, especially to permit the data from the private sector, and also to ensure, other speakers already mentioned, that ethical issues, because we cannot share we have to share the anonymized data to the researchers and also sometimes to the policymakers. So a e-health act, I think, is really important. And when we say these, master data warehouse or central level data, we have to look into the compatibility of the softwares that everybody is used. Now in DG Health, I know that DG Health and DG Family Planning, their software is compatible with BBS, but maybe we need to check of the private sector software compatibility so that data can be pulled into. Technology is changing every time, so we need to consider that how we ensure that the change in the technology, and we are providing training to all the stakeholders so that they can keep pace with this technological change. This last point, I know time is short. So financial data, I think as I work on budgeting, so I think IBUS, Integrated Budgeting and Accounting System, they have developed fantastic work, and they are compiling all the budget and expenditure data for all the ministries. But I have to say that the health ministry is slightly different, and many of the economic code of health ministry doesn't apply to other ministries. So it should be taken care of that some economic code for the IBUS might be different. And just because there is no code, we could not spend, I think last year, 1,000 crore taka, but just because of this code, economic code issue. So I just took the opportunity to say this is because whenever we talk about Ministry of Health, budget allocation, spending of budgetary, all this. So we just connecting these, that we could not use the budget for Ministry of Health because the IBUS and the system and economic code were not, sometimes compatible. So there needs some work. Last point, qualitative data. Whenever we talk about data, we always focus on the quantitative data, but I think there are lots of qualitative data, qualitative information that can be used or pulled together to answer some of the why question or how question. And also beyond the surveys, we should focus, or we should invest on rigorous study also parallelly. I fully agree that we need real-time data and some quick, of course, no compromisation of the quality. I think we all are on the same page, but at the same time, we need investment for research where we can generate effectiveness, cost effectiveness of different intervention for the health sector, which can then again fit into the overall policy-making process. I'll stop there, and thank you so much for giving me the opportunity.
Professor Rumana, thank you very much for those very, very perceptive and useful advices. I have listed down at least 5 of them or 6 of them. To be very short, the first one, you emphasize the comparative learning with other countries. Just to tell you that what we have per capita allocation for health expenditure, 10 times more is being done in Vietnam in per capita allocation in the health. And we know that 60% of our health expenses are off-pocket private expenses. So that's a very good point. The second one is about the 3 R, I would like to formulate them: real-time data, regular data, and reliable data, the 3 R's. The third is the lack of capacity, which is the second or third time it is coming up. We need to take it up at the conclusion. Then the issue of alignment and harmonization, both in terms of definitions and the concepts, you have highlighted very strongly. And then your 3 technical points. One is having a steering committee for coordination at a national level. I don't know, colleagues will tell us whether our government already has one or not. The Honorable Secretary will obviously address that duly. But you have also emphasized the 2 other critical suggestions. That one is the e-health act, and the other is the IBAS code for some health expenses so that money can be properly used, not only allocated. Excellent suggestions. Thank you very much. Colleagues, I wanted to tell you that we had at this moment 82 participants from online with total, and more than a couple of hundred people are on the Facebook, and there are comments which are pouring in already in our chat box. I will invite some of them to, when I now open the floor, to make those interventions before I bring in the ambassador and then the DG of BBS, and obviously finally the Honorable Secretary. So let me open up the floor for a couple of minutes and see how colleagues want to respond to. Some of them have already given their comments. Let me read them out so that we don't have on this. I have missed some of them. Sadi Rumi saying, agree with Morshada Appa, data duplication and interoperability is a major issue. DGHS, DGFP is possibly working with OpenSRP, I don't know what it is, to formalize an open source architecture to ensure interoperability across multiple data systems. Riti Hassan, she's here. I would invite her to speak herself. She has made a couple of suggestions over there. She is the former secretary in charge of the statistics division. Mahbubur Rahman mentions most discussion based on, and we are mostly aware of data generated from government sources, of course, with certain limitation, but probably we are not much aware of data generated from non-government sector. So we are mostly missing an opportunity of data alignment, falling, etc. This is the data ecosystem, the plurality in the data ecosystem we are seeing. What happened to NPR? What is NPR? I don't know, sorry. There is no national, what registration something. There is no category of persons with disabilities in Shuraka app. Very important point. And for us, those who work with those left behind people in SDGs, so this is an important point. And how do we know many persons with disabilities are vaccinated? The data is very important for taking decision. Similar thing happened with the transgender people. When we did focus group discussion, they also complained that for a variety of technical reasons, the transgender people at that time could not register themselves because their picture was not the same as they looked like at that moment. The names have been changed and there had been difficulty, and this point was, I don't know to what extent, has been addressed finally. So we do have an issue with specific communities and citizens in terms of accessing this universal system, what we have over here. So let me open up the floor for very brief comments before I bring in my three concluding speakers, and I would also request Professor Subhan if he wants to add anything. Thank you, sir. So let me start with Riti Hassan. You had been the secretary, so things are moving.
Yeah, thank you for inviting me. And I wrote that what happened to NPR, that was National Population Registration. So everybody should, there was a program and there should be a database on every person. So the question Anil was telling, we could have make an ID card from those surveys. And that's why— So
that has been abandoned. That has been abandoned.
I think so. The new secretary can also comment on that. Yeah. And I hope there will be changes in BBS because of her. And because when BBS makes a survey, BBS never asks anybody else how what kind of data is needed by the other people like NGOs. That's why there's so many duplication of work in BBS in Bangladesh. If we could include make a big team before preparing for a survey, then a lot of questions will be answered by the people, and that will be used by the NGOs also. So in future, maybe there's the committee made for each and every survey can include users also. And I was suggesting to make a grassroots level database. That I tried in early 80s when I was a young officer in BBS, to have a union level. At that time I was doing child nutrition survey, and I wanted to have a union level database with BRAC, so that to make a list, the people who are not vaccinated, the children who are not vaccinated, and the children who are malnourished and all those things. But the file didn't go up because my secretary was very, that time I think Dr. Mushir Rahman was there and he said, I agree with you, Riti, but I tell you when the file will go to the Ministry of Health, it will not work. So we stopped there. So that was, I'm suggesting that days has come, we should work together. Geo NGO should work together and duplication will be reduced. And we should do a list of population so that we can even have a population clock. All the births and deaths will be registered and then at the union level, and especially it will be helpful for the identify the poor people. The list should be hanged in the union office and about the poor people, and then unless they are poor, their name they will not allow you to list.
Thank you, ma'am.
Okay, thank you.
Thank you very much for the suggestion and how to include the grassroots level and non-state actors data system into the thing, and particularly disclosure part also is very important. Colleagues, friends, excellencies, that we have two very eminent institutions represented in our amongst our participants today. One is from the DGHS, because it is all about the discussion on the health-related data statistics and etc. And the other is the IECDR, which had been playing a critical role in the health area, both in terms of research and giving us data-driven policy-making approach. So let me invite colleagues from the DGHS. Who would like to come in? I cannot see all of you here because in this, my computer screen is not enough to bring in everybody. I would like to invite the colleagues from the DGHS, the health ministries. Anybody? Tawfiq, is there any specific person who would like to approach?
Sir, we have Mr. Alamgir with us from BBS.
No, I'm not talking about BBS. I'm talking about DGHS.
So we have Dr. Saima here and Dr. Ripon.
Dr. Saima, would you like to come in? Dr. Saima, Dr. Ripon. DGHS, I also see Mr. Tanvir Ahmed. Mr. Ahmed? Okay, there's no need for pressing people if they're not at this moment comfortable to speak. So that's fine. Anybody else, please? We have number of people who have given comments. Mr. Faisal from Asia Foundation.
Sure, I can just emphasize my questions very briefly.
Please.
Basically, during the pandemic, we saw a lot of descriptive data, how the disease is spreading, how is the coverage of immunization, and all those variables. So my first question is, how do we have we learned, or do we see a trend from such reactive policy making based on static data towards more forecasting based or predictive modeling of data? So basically, I understand that will help in terms of optimizing our resources and in terms of making sure that we are actually going into the right place with the right amount of resources. And the second one is moving really away from static data to dynamic data modeling for policymaking, to understand or appreciate the fact that any policy intervention based on linear data can result in a non-linear outcome, and if we don't predict that, that can be more harmful than useful. So it's both of the questions are intertwined to basically understand how optimally we can use our resources. As an example, how much of lockdown should have been the optimal, or how much of vaccination, or should we actually lock down the whole country versus opening up a few places, or they're based on data and prediction and analytics. Thank you very much.
Thank you very much. Well, regarding this, moving from the static to dynamic and particularly forecasting and a non-linear basis forecasting, these are quite critical. And it will also take a bit more disaggregated look on these issues. Colleagues, before I bring in my other guests, anybody else would like to talk? Intervene, please raise your hand or just let me know. My CPD colleague should help me on this. Anybody else?
Professor Mustafiz has raised his hand.
I was holding him to the end. They say, okay. So if others may get ready, but then let me bring in Mustafiz. Professor Mustafiz Rahman.
Thank you, Dr. Very interesting, discussion. I have just one query, sort of. During the second wave of the pandemic, we were very much disturbed because of the cross-border implications, people coming from India and closing the border. So I was wondering whether when we talk about coordination in terms of data and information within our country, whether there is a case for cross-border coordination as well, and at least some part of interoperability of the system, given the porous border and given that pandemic doesn't have any border. Thank you.
Thank you very much. If that be the case, Dr. Saima Bint Rasool is saying my microphone is not working, so she apologizes for that. We will have her over for some other time. If there are no other comments at this moment, I would like to bring in and refer back to my colleagues. As you know, we had two very young researchers with us, Najiba and Marfia. Marfia and Najiba, where are you? Please let us know. That is Marfia is there, Marfia Alam, program associate. Thank you. And where is Najiba? Is Najiba here?
So she is joining in a bit.
Okay. And I have, you have heard Muntasir and then Tawfiq. Tawfiq, would you like to come in and make any observation which we have missed out from the value of our research? Tawfiq? Tawfiq kothay? I'm missing him now.
So Najiba and Marfia has joined
Najiba
us.
is here. Najiba, thank you very much for the good work. The colleagues have been appreciating our work. So Tawfiq, what happened? Your microphone is muted. Where is he? I can see his name.
Sir, he will join us in a bit. He's just in an important call, so
okay.
2 minutes.
So so Tawfiq, would you like to add anything? And otherwise, I will go to the closure.
No, I think we can go to the closure. Very useful comment. I noted it down. Thank you very much.
So before I bring in the DG BBS and then the Secretary of the Statistics and Informatics Division, let me invite Her Excellency Nathalie Short, the Honorable Ambassador of Switzerland in Dhaka, who had been, she and her colleagues had been very forward-looking and had an enlightened view about the data system, and came along and be a partner with CPD for this interesting venture. And I'm very glad that she and Thomas Bermengarter, who had been with us throughout the process, are present here today. So, Excellency, the floor is yours. You have heard the excitement.
Thank you very much, Deb, and good morning, everyone. Shubho Shakal. I hope that I will respond positively to this excitement. No, dear colleagues and friends, distinguished guests, it's really a pleasure to be with you today. I think the discussion so far, at least very much for me, was very fruitful and very concrete. And also I found very interesting to hear the challenges and also the initiatives that are taken by all the different stakeholders. So when we come back a bit to the general context, we know that both our countries, Switzerland, Bangladesh, share a strong commitment towards the 2030 Agenda for Sustainable Development. And it is obvious that statistics and data allow to monitor our progress towards this goal. And I am glad to hear that the need for critical and usable data is getting heard, as far as I understood this morning. So you also probably know that Switzerland is co-chair of the Global Partnership for Effective Development Cooperation, together with Bangladesh. And we are engaged in this capacity to develop principle and guidance for effective support to data. So the Global Partnership will have its next high-level meeting at the end of 2022 in Geneva, and its focus will be on data and statistics as enabler for sustainable development. So in that regard, the work that is done today is very important. So last October, Switzerland hosted the UN World Data Forum in the city of Bern. You all mentioned about it this morning. So Bern is our capital city. And as host country of this forum, it was our vision to bring the development and the statistical communities closer together. And we organized a preparatory process, which is called the Bern Network, to address the financing for development data. And as an outcome, the Bern Network developed and launched a clearinghouse for financing development data at the UNWDF. And this clearinghouse aims to support a better targeting of financing of data and provide a technical expertise to participating countries. And as far as I heard this morning, expertise and capacity building can be of interest to stakeholders here in Bangladesh. So now from Bern to Bangladesh. In order to strengthen evidence-based policy discussion, Switzerland has supported a number of research studies done by different research organizations. And to give you a concrete example, the study on social cost of migration in Bangladesh by Refugee and Migratory Movement Research Unit significantly contributed to reform policies and practice in the migration sector. So the SDG 16 for the promotion of peaceful and inclusive society is a fundamental objective, and it will be at the core of our engagement in the coming years. So we are planning to launch soon our new SDG 16 program together with UNDP. And within this program, we hope to work with the Bangladesh Bureau of Statistics to strengthen capacities to manage data and statistics in regard to SDGs. Now coming to today's discussion, I'm very happy that our embassy, Switzerland, partnered with CPD to conduct this study, Data for Policy Making in the Pandemic Era, the Bangladesh Experience. And I'm particularly happy to know that this study documents the COVID-19 data initiative undertaken by various international agencies, as well as selected developing countries. And in this regard, we heard this morning that the best practices are very important. And I also understand that the study examined how the pandemic has influenced the mainstream economic data flows. So I really hope that the finding and recommendation of this report know that our path forward will contribute to developing an efficient and sustainable data ecosystem. We spoke about it this morning, and contribute also, as you said, that to buy-in and scaling up that are very necessary step also in our regard. So now we are also about to launch our new country program for Bangladesh for the year 2022-2025. And we hope to really contribute to support Bangladesh to achieve the SDGs. So accurate measurement of the SDGs is critical to achieving the implementation by 2030. And obviously, as some of you said earlier today, the logic behind this is simple: to make evidence-based decisions that will enable Bangladesh to meet SDG targets. Governments, policymakers, and CSOs need to have a clear view of existing conditions, of the current situation, and be able to track progress and act decisively. So today, final validation, as you put it earlier today, is an important milestone, and now I wish you all success for the next concrete steps.
Thank you very much, Excellency. Thank you very much for those comments and encouraging you. First, regarding recognizing the growing importance of data and how it is being increasingly appreciated in the ecosystem and amongst the stakeholders. You have mentioned about the GPDC co-chairmanship, chairpersonship of between Bangladesh and Switzerland, and the next meeting in Switzerland. I am just back from Seoul from the Busan Partnership meeting where the GPDC meeting took place. And there was a lot of discussion about the upcoming meeting in Geneva next year. And the role of data is in this case, which has been brought in the reform process. Thank you for reminding us. And SDG 16 is the jewel in the crown of the 2030 agenda. So we are moving forward, and with the new country frame of the Switzerland coming up, this is an unique opportunity. I think the time-wise, as we can see, this whole work is very much at a very opportune time. The world, the region, the system, the stakeholders are, I think, in that way. So thank you. We are greatly appreciative of our partnership. I see number of colleagues are from IECDR and others are saying, putting in comments. Dr. Ishat. IEDCR. Yeah, DCR. So the Dr. Ishat Siddiq, she I don't know, it mentions that thanks for inviting us. It's a privilege to join the forum. On behalf of IEDCR, I like to ensure that our existing activities on emerging and re-emerging diseases throughout the country will look into the work in a large scale with other scale holders or stakeholders along with that. Thanks. So I will see that. And there are comments also from Mr. Tajul Islam. I hope you will be doing that. And others, Mr. Mahbub Rahman is asking to share the information as we have. Obviously, CPD website will have all these things, and also we will be individually sharing you if you get in touch with me, with us. So let me now invite the DG BBS. In this period, one of our observations in the study was that some of the major national surveys were delayed because of COVID, although some sectoral information were still being collected in that way. So we have a bit of a question in that way. How do you really, BPS as the sole, given the constitutional responsibility you have, going to really absorb and provide leadership and in all this other macroeconomic data and all the health data we are now bringing in? Some people have already raised the issue of public expenditure in the health and etc. So anything for you. Mr. Tajul Islam, the Director General of Bangladesh Bureau of Statistics. Please.
Thank you, sir. Respected chair of this virtual dialogue, Dr. Devapriya Bhattacharya, Distinguished Fellow, Center for Policy Dialogue, respected Chief Guest, Dr. Shahnaz Arifin, NDC, Honorable Secretary, Statistics and Informatics Division, distinguished guest of honor, Her Excellency Ms. Nathalie H. Ward, distinguished presenter, panelists and special commentators, respected participants, greetings from the Bureau of Statistics. Good afternoon. Distinguished organizer, it gives me a great pleasure to extend heartfelt thanks to CPD for organizing such a timely initiative to share the findings of a recent study associated to data issue regarding COVID-19 pandemic, hastening with policy making. I would also like to thank the organizers to invite me here as special guest in this virtual dialogue. Distinguished participants, I would like to thank Mr. Muttasir Kamal for his presentation on the qualitative study conducted by CPD, for his detailed presentation on data ecosystem during COVID-19. The presenter has clearly interpreted the mapping of data domains, including the taxonomy of health-related initiatives, economic data flows, along with the summary findings of the study and its recommendations. Dear participants, we are meeting here when Bangladesh has been recommended to be graduated from least developed countries by the UN. You will be happy to know that behind the scene, Bangladesh Bureau of Statistics as the National Statistics Office played the vital role to generate and provide all the official data on behalf of Bangladesh, based on which Bangladesh has been evaluated for the graduation. Not only for the graduation, BBS is working hard to provide quality official statistics for all the national and international development reporting and policy regularly. Despite the limitations during the pandemic, BBS, despite of limitations during the pandemic, BBS continued its operation in different modes to provide data support to the government and the international agencies as requested. At this point, I would like to mention here that BBS has conducted two nationwide telephonic survey. First survey is the perception survey on livelihood in last September 2020, and second one conducted in the April 2021 on COVID-19 transmission risk assessment survey, with a focus to COVID-19 transmission and health concern for estimating at the district level. Both these surveys provide nationally representative estimates, which are also covered in the survey. The findings help the government to take new initiatives to formulate and update the strategies and policies based on evidence for COVID-19 responses. We have also conducted a rapid survey on poverty assessment this year for providing policy support to the government regarding the poverty and employment, which we will after disseminate the result. Distinguished participants, you are aware that the present government always focuses on data-driven decision making. As the National Statistics Office, that is NSO, Bangladesh Bureau of Statistics is playing a vital role in this evidence-based planning. We also know that Planning Commission has prepared and has started implementing COVID-19 sensitive 8th 5-year plan associating with Sustainable Development Goal. BBS has provided image data support for General Economics Division for preparing 8th 5-year plan. Just immediate before the COVID-19 pandemic, BBS has conducted the Urban Socio-Economic Assessment Survey in partnership with the World Food Programme and IFRI. The survey report was used as the baseline situation of the urban poor group before the COVID-19. BBS has played an effective role behind the scene for budget preparation of the 2 fiscal years, especially providing data for targeting the areas of social security programs throughout different initiatives, including poverty mapping, slum census, geocode data, and other data preserved by Bangladesh Bureau of Statistics. One of our big learning from the pandemic that BBS should not continue work with the conventional data generation, but also incorporate new initiatives in national statistical system, including use of big data through artificial intelligence, machine learning, Internet of Things, data analytics, and modeling, etc. We have already started process to build our capacity with the help of UNSD through Data for Now initiative. We use those innovative approaches to generate official statistics in future. Though the Statistics Act 2013 ensured the data privacy and security complying the fundamental principles of official statistics, we feel the need of a standalone policy for statistical data privacy. The recommendations of the study will help us to rethink, update the capacity of the way of work in NSO. Finally, thank you all once again for your patience hearing. Again, thanks to the organizer for inviting me here. Thanks to all. Thank you, sir.
Thank you very much, Mr. Tajul Islam, for that very structured and very informative intervention. But let me start by thanking you for allowing your colleague, Mr. Alamgir, to join us at the Bern World Data Forum. That was, I think, was a very useful partnership between the private and the public in that sense. So I think that was a much appreciated. I see Alamgir over here today. So he made good contribution over there. I'd like to convey that to you.
Sure, he will join.
Yes, he is here today. Thank you very much. First of all, I think everybody appreciates the role of BBS. I think at another point I have mentioned that in the world now, the data is supposed to be, or is supposed to be the, the fifth pillar of the state. If you have the judiciary, you have legislative, you have the executive. And if you think media is the fourth, then the fifth pillar of the state is the data information, and BBS should be given the ultimate priority, both constitutionally and regulatory wise, and it ensure its independence and be properly resourced. Because the resource gap is a huge thing given the new demands on other things out there. We do appreciate the quality you are looking at this moment. The surveys which have been done in between, whether it is the rapid surveys and also the telephone surveys, on number of them which have been done, and the contribution BBS made in terms of providing data to the budget preparation and 8-5-year plan. But I also take particular satisfaction from the fact that the BBS provided the data for LDC graduation, since I sit in the UN Committee for Development Policy, which decided on Bangladesh graduation issue. So it was a matter of, for me, the national pride to have the data properly reported over there. Thank you for that over there. And that you are moving beyond the conventional data to Internet of Things. Excellent in things, reassuring. And I hope and pray that the consultation or the relationship, the technical and the professional relationship with BBS and with the other actors who are present here today, from the non-government actors, including the university, academia, analysts, and NGOs who are on the field, will grow from strength to strength under your leadership and the leadership of the Secretary of SID over here. Thank you very much. Ma'am, now it is your turn. You have heard us all very patiently. I do appreciate on behalf of the organizers for giving us this time. It is a testimony to your commitment and your integrity and your appreciation for this whole approach. We are so happy to have you over here, and we look forward to hearing you. Dr. Shahnaz.
Thank you very much. Assalamu alaikum to you all who are present here in a virtual dialogue, and also the chair of today's virtual dialogue, Dr. Devobroto. And I'm also a fan of you, and I try to read all the publication from you, not all, but at least I take a look on your publications. And my special thanks to Her Excellency, MS Nathani Chowdhury, Ambassador, Embassy of Switzerland, Bangladesh. It is very inspiring for us that you people are always with us. And actually, today it is my first meeting, a kind of forum like this. So I'm a bit excited, and actually I don't know how to start and where to finish. So I beg your pardon if I say too much or if I say too less. Actually, you all know what is SID, so I don't want to put that much light on this, but for formalities, SID, that the Statistics and Information Division under the Ministry of Planning, is responsible to supervise the Bangladesh Bureau of Statistics, which is heading by Tajul sir, the National Statistical Organization, we call it the NSO. And SID also responsible to enhance for a strong national statistical system and collecting and disseminating of statistics on population, demography, agriculture, economics, as well as other social indicators that trends to economic growth and development through Bangladesh Bureau of Statistics. And you all know that we have a National Data Coordination Committee. Somebody was asking who coordinate this data, and I found that there is a National Data Coordination Committee. Because of my very short tenure till today, I have not been able to attend this meeting or organize this meeting to see how they function. So in next other like this meeting, I may put details on this on the activity of National Data Coordination Committee from my personal experience and from the experience that has been gathered by this time. So, but we are providing data to SDG. We have created a SDG tracker, and which is a very good mechanism for providing data for SDG indicators, and we are almost giving the all data for the needed indicators, and we are expanding our data sources field because we call it we are digging data. Actually, datas are there, informations are there, but as somebody here says that we need time-based data, quality data, and the usable data. And the BBS and the SID is trying to have those data and to actually transfer of information to data. I will say like this. So we are trying to get all the indicators data from our country, and we also do the vital statistics. Probably the professor of Dhaka University was talking about the village people's incorporation in the data system. And for your kind information, very politely, I want to say that our CRBS system and our NID system not only cover the urban people, it also goes to not the up to the Upajala, it goes also to the village to village. We are in a process to count every death and every birth through our CRBC program. So it is a good initiative. Yes, it may not be in a optimum level or in a appreciating level yet, but our attempt, our trying and our process, you can appreciate that one, and we're trying, and hopefully this CRBS will, when the CRBS will act properly, we'll have the accounts of every death, and not only the death and birth, but also the marriage and other civil issues of people's life. And in this respect, I think in this situation, I don't want to put too much light what BBS and SID has done in the COVID period, because I think it has been covered by the DZ BBS. So I just want to say that this dialogue is definitely a good initiative. And obviously, I like to convey my thanks to CPD for their nice presentation. And it is a hard work. It shows that. And this kind of work, we need more and more, because in one research don't give us the perspective of every corner. The people who are working with health, we only want to see the health on our research. The person who are working with disability, with gender, there are lots of sectors, and we all try to find our interesting from a research, but one research can cover all these things. So I think we need more and more study, more and more research on this type of issues. The study was actually, I saw that it was based on 3 objectives, and for me, which was equally important. From here, we get obviously also from this study, there was a test of global and international experiences. And I think that will definitely help us to make our own way in a more authentic and more dedicated and more systematic way. And for that reason, once again, thanks to CPD. At the same time, we will fit that the initiative is not the end. So my saying is that this is not the end. Actually, it is the beginning. So we are still, though we are working for long years, but still, I think this is the first generation we are dealing with this kind of data system, and we are trying to make it short, smart, and simple. So we need to go further. Then I like to say that data interoperability. Somebody has said about the data interoperability, and it is very important. If one institution collect data, if that is not interoperable by others, then actually it is we are going to use less use of this data, because every organization, every request, if they want to collect data from the field again and again, duplication happens there. So data interoperability is a very important thing for not only the nation, but for all, and it is a global issue as well. As somebody was talking about the border issue. So from that perspective, interoperability plays a big role. But our basic thing is to data collection and timely data, usable data, and proper data. And for this reason, it is not only the responsibility of the government only, it is the responsibility of all. I will say from one to all, from general people to civil society, to NGOs, to academicians, to national authorities, and all. And I'm happy to see that this virtual meeting has introduced us with the civil societies and academicians who are thinking and working on this data system. And definitely it is appreciating, and it is also opportunity for us to think that we are in the same path, but maybe with different thinking, and time will come when we'll think in a not in a different way, but in a similar way, and we all will look on the goal of our development, and we will do whatever is necessary from our respective position. And for that reason, cooperation and leadership is a must. So we need the cooperation not only within the organizations of the government, but within the each and every sector of the country, as I mentioned, from public to private, from NGOs to civil societies, and from civil societies to academicians. And Rita Hassan was asking about the NPR. I like to answer there that NPR is a mandate of the SID. According to allegation of business, we are supposed to do the NPR. It is National Population Register. This register will give each and every data of a person of a country. For us, it is the Bangladesh, but unfortunately, we are not yet been able to start this work with this register, but we are at this now we are thinking to have a initiative for having NPR. By this time, many development have been done in CRVS, in NID, in other educational data system, in NSS system, that is not National Social Security System. So NRP, we need to think in a different way. Now we don't want to start from the zero, but what has been done up to this time, we need to have collaborate and cooperation and interoperability of the available data and also the data sources. And our Her Excellency Ambassador Switzerland was talking about the BEN network, and I know that my BBS has also participated in this workshop. So I think there is a good opportunity and platform to work with this issue. And in future, I'm looking forward to work here in more. And Devobroto sir was asking about the technical issue. I think A2I is supporting us in a very good manner from the technicality of this data system. At this moment, I think we don't need to think more about the technicality rather than the A2I's facilities that are providing. That is at this moment from it is definitely my very personal idea that it is enough for us at this moment to remain with A2I for the technical assistance and things. And data policy making, the madam of Dhaka University was talking about the, if I am not wrong, then she was talking about the policy formation to policy to practice. Actually, this part of the data is the administrative aspect of the data application. The data from data to policy is the data management thing, but to policy to practice it is an administrative thing. So we need more expert to transfer data to the policy issues. The correct data for a specific policy is required for have a accurate, effective, and time-worthy policy. For that reason, we need a general knowledge for what policy we are going to form and what information is required to have an effective policy for this. And it is just about the technical knowledge and the general knowledge about data generation and the use of data. I think we are also working in this field, we all together, and in the near future, we will have to have an expertise of this, and we will get more efficient policy, and from our administrative excellency, we will be able to put it into the field and practice it into the field. And I will say we are on the way of development. We are dreaming for a developed country, but we are the soldier of the development. So as a soldier, you can't get the field very, very picturized. You will have to make it fair, fine, and smart for the next generation. And from that perspective, I will think that this is our responsibility, that this generation's responsibility, because we are the first generation that are dealing details with the data. So it is our responsibility to make ready the data systems and this world for our future generation. And with this word, I like to conclude that lastly, with this fight against the all odd things that obstacle our development. I hope that we will together will be able to make all these this kind of good initiative in a more and more, and this will help us to have data administration, and we will, in a word, I will say administration, which includes all from collection to application. And with this ability and with this expertise, we will have to have a very developed society, that is Bangladesh, future Bangladesh. Thank you all.
Dr. Shahnaz Arifin, the Honorable Secretary of the Statistics and Informatics Division. Dr. Shahnaz, a warm thank you to you for this intervention and staying with us for this full time. You mentioned we are in a data war for a better Bangladesh. And I would say that you are and you mentioned at one point in time, the cooperation and leadership. So you are the leader there, and we are the foot soldiers. So I
believe in teamwork. So I need all in my team. Thank you.
Of course. And you had been so open and candid about the issues which you have presented, and warmly welcome the other non-state actors in this whole effort. That's much, much appreciated. I do take note of the role of the SID, and including the NPR or the National Data Collection Committee, Coordination Committee, but also the SDG tracker with the good work it is doing. But your full emphasis on multi-stakeholder approach is very, very well taken in that way. And the cooperation and leadership issues over there. And as you have all put together that we will be in this, although there are diversity in views, I don't see adversities in views. I see diversities in views.
Yes.
And this is the collective strength to take the issue forward. And we look upon your leadership in this case very much on that. Colleagues, I just wanted to let you know it is more than 2 hours now. We are here. I am pretty sure you have more important business to do during the day, not to mention of the lunch which is coming up. I apologize that we didn't have that opportunity to do it in person because of the health reasons at this moment, but there will be other cases when we will be able to meet up and have more face-to-face discussion. I want to tell you that we had a maximum number of 84 participants online, and we have 330 people through the Facebook who have viewed your interventions. Today's discussion will be available on the YouTube channel, which you will be able to link and also recapitulate all the issues which have been discussed today. Just to let you to summarize and conclude today over here, I would definitely like to thank my team for doing this excellent business. We now see that the hard work which we have put in during the COVID period, and which was not easy, and many of you had been part of our expert group meetings earlier as well. We really thank them all for that. That is one. I would like to thank my CPD colleagues who have organized this event today, led by Obra Bhattacharjee, Sarwar, who has been on the panel, the Anika, and many others who have been doing Annesha, and many others who have been doing the groundwork to make this function happen very, very smoothly. I want to thank the panelists over here for making time and sharing their knowledge and wisdom with us. And definitely to the ambassador, she is a great friend on many counts, and to making this time for us. I would also take this opportunity through you to thank Thomas Barmergatter, who had been with us throughout this study, who has been present, but I didn't ask him to take the floor, but we always get his advice as necessary. And I'm particularly grateful to the DG BBS, Tajul Islam Shahab. He is a different person because I have found him to be much more open than many others. Some people hold data like national secrets and think that any disclosure will really jeopardize our development. We always say that data is generated in order to analyze, to take our country forward. So we find ourselves very much attuned. And today it was a refreshing listening to the Honorable Secretary, Dr. Shahnaz Arifin. I go back after this meeting with much more enthusiasm, much more positivity, and much more creative energy after listening to her. To say the least, that the Bangladesh during the last 1 year or two has really made great stride in data generation, data initiative, and digitalization, which is totally out of line with our per capita income, although per capita income is increasing. But if you look at the level of data initiatives and the per capita income level, I think we have really leapfrogged it. After doing the Bern conference, we know it much better now in that way. So this is one. But having said that, we now know the new challenges. The new challenges, of course, is systemic improvement. Systemic improvement would definitely need better coverage, better instruments, more resources, and we need to go much more beyond the health. So, which essentially means that we would need not only consolidation and coordination, but also scaling up and scoping up. So that would be the other point I would take back today. Multi-stakeholder approach has been emphasized number of occasions. SDG data relation has been emphasized number of occasions. The issue of the capacity development and technical issues, both soft, hard, and spongy, how that has been mentioned, human resources issues, all these cases, and how to invest in them in the future. And also along with that, on the capacity, the systemic concern was the harmonization and alignment issue, which came up finally. But let me end by mentioning that at the end of the day, it is not that there was no data before. There were data, but the policymakers did not make good use of that. That is the reality. So either they were not aware that these data were there, or they were not aware how to use them, or they were not really see an alignment between their functional objective as a politician and the use of data. I think on all three counts, we have a role to play in the coming days in terms of creating that mindset and also putting in place instruments so that we can really reach out to the partners and on that. I must tell you, at CPD, we are also, myself, Tawfiq, and other colleagues who are here, we are implementing another study along with Asia Foundation. I don't know, Faisal is still here, Faisal, on the fiscal data issues. And fiscal data issues is very critical. It's disclosure issues and it's use issues, timeliness, reliability, everything, and it's a consistency. So, for example, we have done recently one meeting on this issue on these data with the members of parliament. We'll be doing another meeting with the members of parliament, and we will also doing also trying to build that capacity within the media community as it goes. So as you can see that we are standing, research and analysis group is standing as a bridge builder between those who are actually going to use and who are actually producing at this moment over there. And we are very happy that we got that support and buy-in from all of you today, and we will do it jointly together. Data issue, information, transparency is a key issue for ensuring democratic accountability and taking our country to the next step of high middle income country and post LDC graduation. So on this 100th year of our the Father of the Nation's birth anniversary and 50th anniversary of our own country, I think it's a very, very opportune that we grapple with this problem and take it forward. And it's greatly, satisfying that we have a great coalition to take this collective effort forward. Thank you very much for being here with us today. Take care.
Thank you.
Thank you.
Thank you. Thank you.
Bye-bye.
Thank you, Deb.
Thank you.
Thank you.
Recording stopped.
All the best to all of you.
Thank you,
Thank
sir.
you.
Leaving
Thank you so
the-
much.
Yeah.